All right. Thank you everyone for coming tonight to the Yeshiva University Medical and Dental School Fair. We have a list of schools today speaking to us, and we're going to start right away since 6 o'clock already. For our first speaker tonight is going to be Miss Crystal Ripa from Upstate Medical University. Everyone can please give your attention to Miss Ripa. Thank you.
Hello, everyone, and thank you for having me. My name is Dr. Ripa. I am at SUNY Upstate Medical University, and I know I have 12 minutes, so I hate the idea of not leaving time for questions. So if I sound like I'm running a race with my presentation, it's not intentional. It's to make sure everyone can ask questions. Also, for those of you who want to go in pediatrics, my 3-year-old may do a cameo here or there. He may yell in the background. Alas, here we are. So a little bit more about us at Upstate. So we actually have a BSMD program between Yeshiva and Upstate, but for those of you that are undergraduates now already in following more of the traditional track, it's really important to know more about us. We're in Central New York. We're one of 4 academic medical centers in the state. We're the region's only level 1 trauma center. So basically any Mercy flights that go up, they're all coming to us from Pennsylvania to Canada, and then the opposite footprint the other way. We are a state public institution, so we have a preference for New York State residents. We have 2 main hospitals and 70+ outpatient centers and 2 campus sites for medical students, Binghamton and Syracuse, not Syracuse University, Syracuse downtown. And so both campuses are accredited the same. They have the same match rates, same pass rates, the same step exam averages. They are simply kind of providing somewhat of a different experience for like hands-on, more longitudinal family medicine clerkships, things like that, okay? People delineate which campus they want to go to of 4 options, either Syracuse only, Syracuse preferred, Binghamton preferred, or Binghamton only. When you go into that middle section, the preferred, it gives you a little bit more flexibility in what's called a hold list. So that's more probably nitty gritty than you wanted or needed to know, but just a little bit about us. So these are all of our different medical programs. I included physician assistant on this list, not because it's an MD or medical program, but it is a high level graduate program that is 27 months. Many of you are probably familiar. So just something to consider. And I make sure that students know that that's an amazing career and actually has better initial salary outcomes and a return on investment. Although obviously being a physician is highly, there's a lot of return on investment farther down the line. So we have an MD and MD MPH program for those wanting to go into public health as well. An MD PhD program, the PhD is in biomedical sciences. An MD MBA program, and again, MD MPH and MD MBA, the first year is the additional year. So this way, you're not stepping out of your medical education and stepping out from the opportunity to go through with your class. You're doing your MBA or your MPH first. This is our first year that we are opening up the MD MBA for applicants. We're joining, our pilot group starts this year. We also have a rural medical scholars program because we are in Central New York. We are surrounded with a lot of rural areas. And so our rural medical scholars program isn't an extension of time. It's just some of that time is intensely intentioned to be in rural sites. So about successful applicants, context and holistic review are important to remember. So your story really matters, right? There's only been a few students in my history, my decade at Upstate, that I haven't been able to kind of help them work through either explaining or addressing a particular deficiency that they view on their application. These are just some statistics so you're understanding what our most common students are matriculating to Upstate with. And I always tell students that the best thing they can ever do when they're applying to medical school here or anywhere is applying early and applying broadly. Those are incredibly, incredibly important. And also to remember that admissions committees, admissions officers are not here to be judge and jury. They are strictly here because attrition and graduation are their business, are their love language, if you will. And so we are using these metrics in some sense to try to understand who we can put in seats that will succeed. We do have a preference for New York State residents because we are a state public institution, and our mission is surrounding making sure we're plugging in our residents to our communities to serve. Successful applicants also have strong clinical experiences, a lot more than shadowing, hands-on, EMT, CNA. These are amazing medical assisting, medical scribing. Recent and ongoing clinical experience is absolutely necessary. And it is almost a time we've had an increase all medical schools over the course of the past 2 years during the pandemic. And some of the optimists are like, oh, you're looking to, you know, run into the fire as it's storming, as it's brewing. And the less optimistic are saying, oh, maybe medical school applicants think we aren't paying attention. But as a physician, you would not be able to head away from the field. So we really want to see that you've stepped up to be a helper, right? And shadowing and volunteering in a clinical space are likely not as accessible right now because there's more liability for an institution when you're not onboarded and protected by, you know, employee insurances, et cetera. So just digging a little bit more into why that matters. So we also have a preference for strong ties to upstate. And that doesn't mean that you had to live in central New York. It means, hey, I went to a presentation from Dr. Ripa and I really liked what she had to say. And I would take that very nicely. But it also means that, right, there are things that you find a fit and you want to pursue it further, okay? So just make sure when you're filling out a secondary to any institution, don't click the things that say found on a web search or on MSAR. It doesn't help us understand why you want to be there, okay? So be strategic. Some would say that as manipulative, but medical schools, there are a lot of applications. You have to be strategic. It is kind of just playing it smart, if you will. And we have a particular interest, as does the nation, in fulfilling the primary care shortage. So not to say that we have all of our applicants going into primary care, but the nation should be interested in addressing the upcoming primary care shortages. So that is an extra kind of feather in your cap if that's really an interest of yours. So a little bit more about the medical school particularly, and you know I haven't talked much about PA. I just wanted you to know that it existed, and we also have four colleges total. College of Medicine is just one of the colleges, but I know that the theme of today is more about medical and dental. So about the medical school, we have a low attrition rate. Whenever you're shopping for any medical school that's a good fit for you, again, early and broadly, so broadly, no less than 20 medical schools. I would be hard pressed for someone to convince me they should apply to less than 20. And almost never would I recommend a student to apply early decision. Okay. So when you're shopping for medical schools, it's really important to ask them about their attrition rates and their match rates. Okay. How many students did they keep and how many students they successfully get into residency? Because you are spending a lot of money, energy, time, stress going through medical school. Are we successfully giving you the tools to get to that end goal of being a physician? Okay. You will hear kind of a hot topic that medical schools are trying to get earlier and earlier clinical exposure and training. It helps medical students when they're going through those basic science first 2 years to kind of see the light at the end of the tunnel, and for students to kind of embed the applied learning alongside of the practical and kind of scientific aspects of medicine. So we have some early clinical exposure and training, specifically in our practice of medicine course, and a lot of standardized patients examinations. Coming soon, we'll have a 3-year curriculum option. And this year we had a 100% match rate, and that was 97% optimal match. So that means very few of our students went into the scramble. If that didn't make any sense to you, it's totally fine. But match is basically the algorithm that decides where you go to residency after you do interviews. And if the week of match week, you don't match through that algorithm, there's another one that's kind of set up, and that's what leads to a final match rate. I like to talk about optimal match because people should ask, people should know, okay? Across the past 5 years, we have around a 98% match rate, which is really, really great. We're really, really proud of that. You always want to strive for 100. It's not always reasonable or plausible. So the last thing I want to do is share more opportunities with all of you to be able to continue to interact with us. Not only do you see our my email address there, I'm on vacation after this presentation for the next week and a half, but usually I'm pretty fast to respond to email. So I will share these couple of things in the chat about the link to other opportunities as well as my email address. And thank you so much for having me. I can take any questions. I would like to acknowledge I finished a minute early for these questions.
Hi, Doc. Hope you're doing well.
Yeah, I'm doing good.
I wanted to ask, it didn't necessarily state explicitly that you need any sort of clinical research that you're looking for that. Is there any weighting towards that or more towards the actual practical side of it?
So the only place where research is a requirement is applying to MD, PhD. You do not, research is not a requirement to apply to the medical school or the other programs, albeit about 80% of our students do have research coming in the door. Other schools do have a research requirement. So I think in order to make yourself marketable broadly, research experience is a good idea, but it's not a requirement for us.
Thank you.
You got it. Okay, any other questions? Well, like I said, my email address is in the chat. If you get my away message today, no, it's because I'm on vacation, but I will get back to you shortly after. And thank you guys for thinking of us and inviting us. And it is an absolute pleasure. Okay.
Thank you very much, Dr. Ripa.
You're welcome.
All right. So for our next presenter she is from Touro College of Pharmacy. This is Miss Haiti. She's on, correct? Yes.
Yeah.
All right, go ahead, Miss Haiti. Thank you.
Okay. Thank you so much for having me. I'm having a hard time getting it into mode, but I'm Heidi Fuchs, and I am from Touro College of Pharmacy, and I'm the Assistant Dean for Admissions and Enrollment Management. And I think I'm frozen, but if not, I hope you can hear me.
We can hear you, just your screen sharing isn't working.
Oh, there we go. Now it totally
Oh, now it's
okay. Okay, it's my home connection, so sorry. Okay, so question, why pharmacy? Clinical pharmacist median salary is $152,000. So pharmacy school is 4 years. You're a doctor of pharmacy. Your friends, your family have to call you doctor, and then you can go on to work in many different areas. Practice areas include clinical, industry, long-term care, which would be a nursing home or rehab facility. Managed care would be the insurance company side. Public health, and of course, community pharmacy, the pharmacists you're familiar with when you walk into your local pharmacy. There's a huge ease of transitioning between specialties. So that's really a great reason for pharmacy. We have faculty that have started off in acute care, and they have gone on to ambulatory care, and then gone on to internal medicine without any additional training. I'll explain more in a moment. So there are many, many clinical practice areas in pharmacy. You'd go for your 4 years of your PharmD degree, and then you can go on to pharmacy residency for 1 or 2 years. So 1 year, you can become a clinical pharmacist. You can work anywhere in a medical area in the hospital. But if you go for a 2nd year, then you can really become a specialist. And I'm going to explain just a few of them. This is literally a limited list. Ambulatory care is the hospital's clinic. It's outpatient. There's a shortage currently of physicians who are interested in going into the hospital's clinic, either because it is not lucrative enough or it is not prestigious enough. So now pharmacists are physician extenders in this area. They have prescribing rights. They treat patients. They will order blood work, kidney function tests, etc. Then you have critical care. So that could be the ICU, the CCU, the PICU, the NICU, the PsychU. oncology. So if you think about it, at Sloan Kettering, there's got to be over 200 pharmacists working there. There, they actually are very specialized based on the specific area of cancer that a patient who is inpatient is experiencing. Cardiology, which is often found in the ambulatory care area, nuclear, home care, opioid. The one I love to say is antimicrobial steward. Imagine if you're out at friends for Kiddush on Shabbos and they ask you what you do and you say, I'm an antimicrobial steward pharmacist. When a prescription is written for infection in the hospital, the pharmacists or the specialty, they have the subject matter expertise on 9,000 plus medications. So anytime an antibiotic is prescribed, it has to clear through the antimicrobial steward who determines, is this prescription the most targeted antibiotic for this particular condition, taking in mind if a patient's been on this antibiotic too regularly, they'll have antibiotic resistance. So it's a pretty powerful position because they are the gatekeeper for all antibiotic prescriptions. There's also transplant pharmacy, hospice, psychiatric. Pharmacogenomics is a really popular one now. It's where you do DNA testing for a patient and the medication is actually customized for that particular patient. It's usually found in a pain management area or in a cancer area where maybe a patient's unique DNA allows them to metabolize medication differently. And now insurance companies are covering customized medication because over the course of treating the patient, if we start with customized medication, it'll cost less over the course of the treatment. Then you have emergency care. It's certainly you have to have the right personality to work in an ER. You have to literally know everything. You don't know who's coming in. It could be pediatric. It could be geriatric. You have to give instructions on what medications, what dosage, and how to push the medications. And then there's peds, infectious diseases. Many patients in the hospital come in for one thing and develop a hospital-based infection. So that's a very, very sophisticated area. And certainly during COVID, it was a very, very busy area where there was a great demand. Diabetes is usually found in the hospital's outpatient clinic, nutrition support, hormone medicine, pain management, surgical care. So pharmacists are actually in the operatory, veterinary. So if you are an animal lover and you'd like to go into that area, certainly there's an opportunity for you. Drug information is more of a research-based role within the hospital. A physician might say, my patient's condition is such and such. I've heard about a new medication. I'm really not familiar with it. Can you please provide me with a summary of the research? Or my patient has such and such, what would you recommend? And it's a summary of the research. Regulatory, so that's really where you would be working with the FDA and clinical trials. So in many hospitals, pharmacists are involved in clinical trials. So why Touro College of Pharmacy in particular? We have the highest NAPLEX pass rate, so that's the National Licensing Exam pass rate in New York City for colleges of pharmacy that require prerequisites, and in Bergen County, New Jersey, where I happen to reside. We have a 99% employment rate. Our students are graduating and getting jobs in their first choice areas within pharmacy. We have more experiential education than most colleges of pharmacy. Most colleges of pharmacy will have 36 or 42 weeks of clinical experience, and we give our students 54 weeks. So what that means is you're only in the class for 2.5 years. In the last year and a half, you are having experiential education. And we all know that most of us learn much better in a hands-on experience environment. We have a small class size. You'll have probably no more than 60, 65 students in your class. It's an 8-to-1 student to faculty ratio. The faculty know you, you know them. They know when you don't look right, and they will definitely reach out to you and say what's going on. We have generous scholarships and financial aid, and coincidentally, our tuition is probably a little bit less than Yeshiva University right now, and I should know because I'm a parent who's graduated a number of students from this program. And of course, all of our programs are Shomer Shabbos, Yantif, and Kashrus. So you'll always be out early on Friday. You'll be out early Erev Yantif. You will not have exams on Isru Chag. You will not have exams or quizzes on a fast day, and every student organization, every function in the college, and if there's an off-campus celebration, it all is certainly 100% kosher, Glock kosher, and Chal V'Yisrael. We require 67 pre-pharmacy prerequisite credits. So there would be science, math, English, humanities, social behavioral sciences, and you do not need a college degree. We had required a college degree. We were one of 6 colleges of pharmacy out of about 140 in the United States that did require it, and we changed that requirement. Also, the Mcat of pharmacy schools called the Pcat, and it is not required either. We don't have a minimum GPA, but our average GPA is a 3.24 overall and a 3.0 in science and in math. We do a holistic review. While we don't require specific experience, it is certainly to your benefit to have some sort of healthcare experience in pharmacy in particular. We offer now a collaborative degree where in 4 years or in 5, you can complete your PharmD and MPH, which is a master's in public health. And very excited that Stern College students do fabulously in our program. They always make our Rokai Honor Society. And I look forward to the day that I can actually say Yeshiva University students, Yeshiva College, and even SciSim students do fabulously well in our program. We are moving to 3 Times Square in 2023 next summer, and I'm really excited about that. And I don't know if I've gone over my time, but I'm certainly happy to take any questions. There is a common application called PharmCast, and you fill out one application and you select whichever colleges of pharmacy you'd like your application to be received by. Any questions? Okay, thank you so much for hosting us, and I look forward.
Excuse me, Heidi.
Yes.
I would actually like to ask a question.
Sure,
And
thank
this
you.
is in general about the Toro system, and I don't know if you feel that the College of Pharmacy is different, let's say from the DO program or even the PA program. But should one, when one is talking on an interview about why Toro, what is your feeling about mentioning the fact that one of the reasons you're applying here or that attracts you to the program is that it is Shomer Shabbos, or that it is, because one never knows who one's interviewer is, right? So what is your suggestion?
That's a great question, Naomi. I'll tell you, first and foremost, the thing that I never, ever want to hear is that I chose your program because it's conveniently located geographically. That's just, I know you didn't ask that, but if that's your top reason, I don't want to hear it. Keep it to yourself. I would say certainly the first thing that we should hear from you is something unique about our program, a program in any of the Turo schools that make you interested in Turo in particular. If it's DO, you should know why. I know Steve's going to talk later, why specifically osteopathic medicine versus allopathic. If it's PA, why do you want to be a PA? And if it's pharmacy, the same thing, why pharmacist? What is unique about our program? I shared a few unique things. And at the end, it's certainly fine to say, and specifically, Turo is so accommodating to my religious practice, and that is really important to me as well, but I wouldn't make it the first thing. I put my email address in the chat. If you Google Heidi Fuchs, Turo College of Pharmacy, you'll find me. I also do have a blog post on the top 10 interviewing points. It's for pharmacy interview, but I certainly think it is a great opportunity for anybody who's interested in getting some pointers for professional school interview to check it out. It's pretty common sense, but can't hurt to check it.
Can I ask a question? Are there opportunities for students to do some research in the summer with some of your pharmacy faculty?
Lolita, what a great question. Not only is there opportunity to do research in the summer, there's opportunity to do research during the school year. And we're so close to both Stern College and Yeshiva University, Yeshiva College, that anyone who's interested in doing research, even if they're interested to build their pharmacy application or even their medical school application, should certainly feel free to reach out to me, and I will introduce them to our Associate Dean for Research. I can tell you that a student from Stern who we admitted for this upcoming year, last year did research in the summer, and she is being published, and she is the lead on the publication.
That sounds wonderful. Thank you so much, Ms. Fuchs, for that for the overview. Just to keep on track, the Temple University School of Podiatric Medicine, Ms. Sneed, are you ready to present?
Yes.
Perfect, thank you.
Hello, everyone. My name is Katira Sneed. I'm from Temple University School of Podiatric Medicine to talk to you about opportunity within medicine that a lot of people may not think of firsthand, or have the misperception that you have to go to allopathic or osteopathic in order to become a foot and ankle surgeon. So podiatric medicine is the specialization of the lower extremities of the body, primarily the foot and ankle. There are three major areas of podiatric medicine. It's general medicine, which a lot of people know about, dealing with the corns, the calluses, bunions, and things of that nature. And then it's podiatric orthopedics, dealing with the gait analysis of an individual. What makes a person walk a specific way? Why are they standing that way? What are the pressure points in their body? And as a physician, how do you go about offloading the pressures? But then tied into that is the sports medicine piece, dealing with athletes, torn tendons, torn ligaments. They break the ankle, they sprain the ankle. The thing about podiatric medicine is that you also are a board certified surgeon. So you are trained to be able to take the whole foot and ankle apart and put it all back together again. So when you hear the term podiatrist, podiatric surgeon, podiatric physician, it's all kind of one and the same. And you do have to go to school do your undergraduate career, and then do 4 years of podiatric medical school. And then you have to do at least a 3-year residency. So the way it's designed is the first 2 years of podiatric medical school is classroom training, where you're doing the basic science courses, the physical diagnosis courses, and all of the basic science courses at Temple are taught by Temple's allopathic faculty members. All of your specialty courses are taught by doctors of podiatric medicine, because once you graduate podiatric medical school, you get a DPM degree, Doctor of Podiatric Medicine. You're still a physician. The only difference is the acronyms behind your name, because the thing about it, you're still seeing patients, you're still writing prescriptions, and you're guaranteed to be a board certified surgeon. Some people also go do fellowships after they've completed their residency. When you're doing your 3-year residency, the first year residency is general medicine, second year is forefoot surgery, and your 3rd year residency is rear foot surgery. Temple owns and operates their own healthcare system. Temple owns 4 hospitals, and we also have the Fox Chase Cancer Center, as well as the Foot and Ankle Institute. There's only 9 podiatric medical schools in the US. And as I mentioned, in regards to the 2 years of the academics, and then your 3rd year is clinical. The way we revamp the curriculum, especially through COVID, is to have our students do 2.5 weeks rotations with each one of our clinicians. And we have 16 full-time doctors of podiatric medicine. And then their 4th year, they went on their externships, and that could be pretty much anywhere within the US. Our students take boards after they've completed their 2nd year, and then they take boards in their 4th year. And depending on where you decide to do your residency, you may have to take a 3rd set of boards. And sometimes it's due before you start your residency, to July after you graduate. And depending on the program, some of them do allow you the 1st year through your residency to prepare and complete the third set of boards. The foot and ankle has the most bones in the body, and it's very intricate. The thing about it is all students not only take gross anatomy for 16 weeks, they take lower extremity anatomy for 24 to 25 weeks, depending on how the calendar is laid out. Where do podiatric physicians work? You can work in a hospital, you can do private practice, group practice. A lot of students are starting to join like orthopedic practices, and they are the only ones that are part of that orthopedic practice dealing with all of the lower extremity issues. I know we have about 3 students that are getting ready to graduate that are part of a military program, and they give back a number of years of service once they complete their residency for the time that the military assisted them while they're in schools. You can do a shoe company. Our former medical director was the podiatrist for the Pittsburgh Pirates and Pittsburgh Steelers. So you can do a lot of different things as a podiatric physician. So working as a podiatric physician, there's a number of subspecialties. You can do surgery, you can do sports medicine. One of our faculty members, if you open up any dermatologist journal, you will see Tracy Vahovic's name in it, even though she's a podiatric physician, and she's known nationally and internationally. And she's one of the first podiatric physicians to go on and do a dermatology fellowship. You can do pediatric, dealing with kids severely pigeon-toed, club feet, or have deformities of the lower extremities of the body. In our clinic, about 40% of the patient pool is diabetic patients. So every day don't have to be the same in working in podiatric medicine. So what can you treat as a podiatric physician? Some of these things might sound a little familiar to you. Some of you may have had maybe heel pain if you were possibly a runner, hammer toes, bunions, sports injuries, flat-footedness, ingrown toenails, nail fungus, warts. Those are some common things that people deal with every day that podiatric physicians treat. As I mentioned, when students go on to residency, their second year of residency is forefoot surgery, in which they will learn how to correct a hammer toe, learn how to take a ganglion cyst out. They'll learn how to do a lot of these things during residency, and some things they actually learn while they're a student working in our clinic. Rear foot surgery, they'll learn how to do trauma surgery, corrective surgery. One of our faculty members did one of the first ankle transplants. So you'll get a lot of surgical training as a podiatric physician. We have a limb salvage center in which the clinicians work with the vascular physicians, cardiovascular, infectious disease, endocrinologists. They work together as a team so that way they can determine whether or not they can save a patient limb. And up at Temple Hospital, the Limb Salvage Center has been able to save 71% of individuals that were referred to them, indicating that they may need an amputation. I also mentioned photopediatrics. Kids with club feet, it's a lot easier to correct the issue when they're babies because the bones are so soft. And the clinician actually did a 6-week pretty much transformation of the baby's foot to be able to give them close to normal gait pattern. Feet come in all shapes and sizes. And even someone like this, the doctors will work with them and get them specially made shoes if it's not a way to actually amputate, a certain portion of their toes, because that will also change their gait pattern. So they will come up with different strategies to help this individual have a normal gait pattern. the lifestyle of a podiatric physician. If you look at the 2019 labor survey, United States labor survey, you'll see podiatric physicians was in a ninth and the highest paid profession. And then also, it's one of the few medical professions where you don't have to be on call 24 hours a day. You can do 9 to 5, 8 to 4, still earn a very lucrative salary. You can work, do a whole lot of surgeries if that's what you want to do. You can work in academia, you can do research, you can do a combination. Most podiatric physicians do make sure that they have hospital privileges and affiliations. So that way, depending on if they have any complex surgeries, they can do them in a hospital versus an ambulatory surgical suite. So podiatrists treat the pathologies of the lower extremities of the body. What a lot of people don't realize that approximately 70% of diseases manifest in the lower extremities of the body. If you think about diabetic patients, they develop neuropathy, they lose the feeling, lose the sensation. And if they develop diabetic ulcers, you got to make sure that they don't get infected so they don't have to have an amputation. If you think of a woman when she's expecting, the doctor don't look at the belly and say, oh, it's something going on. Normally she develops edema and it starts in the lower extremities of the body. If you think about cardiovascular patients, the doctor don't listen to the heart and say it's something going on there. They really worry about blood clots traveling from the lower extremities of the body up to the heart and creating additional problems.
Hi, Ms. Mead.
Yes.
Sorry, just we're running short on time.
Okay.
But do you have an email that students could send emails to, like questions?
Sure, I'll put it in the chat.
Thank you so much.
Mm-hmm.
Thank you very much, Ms. Sneed.
Problem. And we're going to have additional events coming up, open house, internship, and I'll be sure to send a copy of that information to you guys.
Thank you very much. For our next presentation, we have Mr. David Aroza from NYTCOM. Mr. Aroza, you can start whenever you're ready.
Good evening, everyone, and thank you so much for having me here this evening. I'm going to make this very short and sweet so we can leave room for a little Q&A. Great news as well. I also brought 2 of our first-year medical students from our Long Island campus to talk about their experiences and answer your questions. So a little bit about New York Institute of Technology's College of Osteopathic Medicine. Many of you are probably very aware of the fact that we do have a location in Long Island, about 24 miles away from Manhattan, but only 8 miles away from the first borough of Queens. But a lot of you may not be aware that we also have a second location in Jonesboro, Arkansas, which was established in 2016. It's on the northeast side of the state, about an hour drive from Memphis, so Elvis is not too far away, and it is on the campus of Arkansas State University. So history as well, we are the first osteopathic medical school to establish in both respective states. I'm not going to go too much into osteopathic medicine as a whole, because that is something we can definitely talk about at another time because of the shortened period of time that I have, but I want to go over the admissions process for all of you. The ACOMAS application, which is the centralized application for all osteopathic programs, the majority, it opens up in May of every year. So for this year, the cycle will open up in the first week of May. We do not have a date determined yet. Mcat scores and transcripts are all sent to ACOM for verification. I do understand that a lot of students that may come from the yeshiva cohorts might have taken credits overseas. They might have taken it at other institutions. You must report every transcript, whether it's overseas, international, whether it's local, that you have college credit for, to ACOM for verification. And I would probably say stay on top of the ones that are overseas, because those could be very tricky and they can hold up your application. Personal statement is very big. It's embedded within your primary. Letters of recommendations are important. I know that Ms. Woodhill is here. I know they have a great, pre-health committee letter. And also we have Dr. Lowy also from the Stern side. So please utilize the pre-health advisory committee if you can. If you are unable to, or if you don't meet the deadlines, you can go rogue and get 3 individual recommendations from faculty that have taught you. And also, if you've been out of school, if you decide to take gap years and you've been out of school longer than 2 years, we will accept letters of recommendations from anybody. We do not require a letter of recommendation from a physician, whether it's osteopathic or allopathic, so don't stress if you don't have one. The deadline for the primary is March 1st of 2023. For those of you that are applying in the future, just add a year. Okay, it's never going to change for us. Please don't wait to the last minute. The supplemental, which is the additional application where we like to get more information from you, that is due on March 8th of 2023, but same thing. Submit it as soon as you can once we give it to you. And I could tell you that we do not have a screening process. Will receive a secondary probably 24 hours after they submit their primary, once we receive the first downloadable applications, which will not happen until the end of June. We need all of this before we can review your application. These are the requirements. Everybody must be a U.S. citizen or permanent resident at the time of application. We will accept the January 2023 Mcat, and we will not accept the Mcat that was taken previous to January 2019. So if your Mcat outdates that, you will have to redo it and submit a new score. A little bit of the profile. This past year, the current first years that are with me came from 10,000 plus applications. The average student had a very rigorous GPA coming out of their undergraduate, graduate school, post-bac, even some law programs. And the average MCAT's about a 506. And this is what our enrollment looks like at both institutions. But it's also these additional selection factors. So understand that your academics mean one thing and that standardized test, but it's also another thing to be actively involved in your community and doing many different type of things that'll really kind of tell us that story of how you got to where you are today. With that said, we have 5 minutes until I know that I have to relinquish the floor for somebody else. So I'm going to ask if my 2 students that are with me to introduce themselves, and we will do some questions before I have to leave for the evening. So why don't we start off with Alexandra?
Hi, my name is Alex. I'm a first-year medical student at the Old Westbury campus.
Hi everyone, my name is Shebin. I'm a first-year student at the Old Westbury campus. I went to NYT for undergrad and now I'm at NYT Com. I'm happy to answer any questions you have.
This is the opportunity. Unmute your microphones, type in the chat. I encourage all of you to turn on your cameras if you are not indisposed so I can see your faces as well. So feel free.
I have a question.
Yes.
To the students, what kind of extracurriculars do you guys personally take part of in as a medical student?
So I am involved in Emergency Medicine Club. I'm involved in Rock Steady Boxing, which is we provide boxing classes for people with Parkinson's disease. And I'm also on the outreach committee at our student-run clinic.
So I also do occasionally Rock Steady, just like Alex said. I'm also part of the outreach committee for the community free clinic. As for club-related activities, I'm part of orthopedic surgery, American Physician Scientists, as well as American Medical Student Association. And aside from that, I like doing research both on campus and at the undergrad campus.
We also have many organizations that are outside of the specialty related areas. And actually this evening, I know a lot of other organizations were up for vote for the Student Government Association, or they're actually going on right now. So we're always looking for new innovative ideas. So if there's something that you find that our campus is lacking, please, you have the platform to do it. Aviva, you have a question.
Hi, I'm Aviva. Sorry that can't have my camera on right now. I was wondering if both of you could speak a little bit about the research opportunities that you have at NICOM, either on campus or how it is getting research opportunities off campus.
Sure. So as for me, I do research within NICOM as well within the undergrad institution. I'm actually a BSTO, so I started early during my undergrad career and I carried that through to medical school. As for research opportunities, it's actually really simple. The NYTCOM website has a list of physicians as well as PhDs that conduct research at the NYTCOM campus. So as for acquiring those opportunities, I would say you could just email them. And then if there are spots open in their lab, then they're pretty receptive about meeting you and establishing a connection. Off-campus opportunities for research, I would say more hospital related with clinical work. In that case, you would have to email physicians outside of NYTCOM or physicians that are related or affiliated with NYTCOM at their respective hospitals.
You do not have to do research with NYITCOM faculty. You can continue with your current PIs if you choose to do so. You can really go anywhere you want and do research. But most of our students will probably not dive into research until they at least get their feet wet for the first several months as a med student to really soak in what they're learning. Because I think our med students say it just like every other med student out there, your amount of information you're going to be taking in is like a fire hydrant shooting water into your mouth. And you have to figure out a way to digest all that knowledge. I think we have time for one more question.
So could you give a bit of information about your matching, like the percentiles of how your students match to different programs?
Great question. So I'm actually going to put a link inside the chat as well. Last year was an enigma for all medical schools. It was a bad year for all medical schools in matching. We only finished out at 96.3% last year, but it was above the national average, which says a lot, and a large class size. Very spread out between the specialties. This year, as of the other day, we only had 2 students that didn't match. So we are at 99.3%. And that is something to say between both locations. So we definitely did great. I'm going to share a link with all of you in a moment. So just give me 1 second while I grab that link. All right. I'm just going to ask if our students can also put their information inside the chat. So if any of you would like to follow up, because I know we have to be getting on to the next speaker, I'm going to put that information in the chat before I leave. But please reach out to me if you have any additional questions. My information is in the chat. Please know that as an osteopathic doctor, you can go into any specialty that you are interested in. But the people who don't match are the ones that don't listen to the advice that they're given. So listen to the advice you're given, follow suit, get involved while you're in med school, because you will have a chance to have a socially active life. You will be able to be in a relationship. You will be able to get married. You will be able to bear children. All right. So please take advantage of the resources that are given to you. All right. Best of luck to all of you. Give me a couple of minutes to put this information in the chat. Thank you all so much for having me.
Thank you very much, Mr. Aroza.
Thank you so much. I now want to introduce the next school, which is the Ben-Gurion University Medical School for International Health. Is Ms. Kelly Coleman on the call?
Yes, thank you for the introduction. Can I just go ahead and share my screen here?
Do you have access or no?
I think so. Let me see.
Perfect.
Yeah. Let me just switch over here. Sorry. Okay, so please forgive me. I'm going to talk quick because I know we have limited time and I want to leave some time for Q&A. Joining me today on the call is Beth Chesser. We're going to each talk a little bit about MSIH and then hopefully leave some time for questions at the end. So the Medical School for International Health is at Ben-Gurion University in Israel. It is an English language track at Ben-Gurion University. Ben-Gurion University, for those of you who have not been there before, is a very vibrant campus life in Israel. It's got about 20,000 students and is usually rated #1 for student experience in Israel. MSIH is one of 2 medical schools housed at Ben-Gurion University. So there is the Hebrew language medical school there, and then MSIH is the English language program. We were founded about 25 years ago as a collaboration between Columbia University in New York and Ben-Gurion University in Israel. So the first 3 years of instruction all take place at Ben-Gurion University. Classes are taught in English. We do teach Hebrew, although those classes are leveled. So somebody who speaks Hebrew fluently will focus more on medical terminology in Hebrew. Year 1 and year 2 are your basic science courses. Body systems, what we do that's a little different is incorporate global health coursework into those first 2 years. So those are electives students can take, such courses like human nutrition, mindfulness in medicine, refugee health, migrant health, all different courses like that. There are some clinical days in the first 2 years. Beersheba is a very diverse area of Israel. So as much as you may speak Hebrew and English, you're going to come across patients who speak Arabic and Russian and French and a whole bunch of North African dialects. So you really learn how to interact with patients from all different backgrounds. By the end of the second year, students take the USMLE Step 1. They can take that in Israel or take that in the States. Years 3 and 4 are much more clinical based. The third year rotations are done at hospitals throughout Israel, but the majority of them are done at Soroka University Medical Center, which is right on campus. You can see some of the statistics about the hospital. It's a state-of-the-art hospital in Israel. Israel is really known for its technology and medicine. What we do also in the third year is students participate in some cross-cultural communications workshops. Again, honing those skills that enable them to interact with diverse patient populations, no matter where they're practicing around the world. Fourth year electives really depend upon where you want to do residency. So the majority of our students choose to do residency in the US or Canada. So they can do their clinical work in the fourth year through some of our hospitals we have relationships with, such as Columbia, Hofstra, the Mayo Clinic, University of Tennessee, or other hospitals all throughout North America. And we have electives coordinators who help with that process. There is also the option for students who want to stay in Israel and complete stage and residency there. They can do their fourth year clinical work in Israel. So this is kind of the beginning of the fourth year. The second part of the fourth year is a global health rotation. So in a typical year, and I say that because the last 2 years have been very atypical, as we all know, students get to go do a 2-month global health rotation at sites that we work with around the world, in India, Nepal, Sri Lanka, Peru, and they really get to see how healthcare is provided in very resource limited settings. They work alongside the local physicians and local medical students and really see healthcare from a whole different vantage point at this point in their career. The last 2 years, as I said, have been different. So last year, students completed much of their global health rotations in the US. There are underserved populations all over the world. So while we really enjoy our students going off and working in India, and Nepal, and Ghana, there's underserved populations right here in the US and in Israel. So last year, our students got to work at places in the US, some on Indian Reserve, some with Christian health services down south, some in mental health facilities, some in the Mennonite community in central Pennsylvania, all over the place. This year, while our students could travel, the sites we work with really are not ready. They're still dealing with a lot of things relative to the pandemic. So they're not really ready to host our students. So our students completed their global health rotations in Israel this year. So in places like the Bedouin villages in southern Israel, in Nazareth, at different sites throughout Israel that again treat a very underserved, diverse patient population. So that's really a recap of the 4 years at MSIH. The first 2 years being more classroom-based, although there is clinical work as well, and the second 2 years being clinical-based. The third year being in Israel, the fourth year students having the option to complete their rotations in Israel or the US and then do their global health rotation before they graduate. Now I'm going to turn it over to Beth that talks a little bit about what happens after our students graduate. Beth, are you there?
There we go. Can you hear me now?
Yes.
Sorry. Good evening, everybody. Thank you for hosting us. Our students are on the path to residency as if they were in a U.S. medical school. Our students take USMLEs in Israel on the same track as if they were in a U.S. medical school. Many of our students decide to stay in Israel. The option of where you would like to do your residency, whether in US or Israel, does not have to be made until you're entering your third year. By then you should know which route you want to go. For our students who return to the US for residency, we have a residency match rate on par with the US medical schools with over 90% every year. And they find they do very well. We work very closely with our students, guiding them through this process, as well as was working with our partners at Columbia University. The Dean of Columbia students will address our students and guide them as well through residency and how to prepare for residency. What's important to note as well is that our graduates are not just matching at top institutions. You could see a sampling of them here, but they're also matching often in the institutions of their choice, in the fields of their choice, in difficult fields. Most of our students will go into primary care, peds, OBGYN, but many go into difficult residencies such as ophthalmology or neurosurgery, and they're matching there as well and doing very well as well. Our students have matched across the US, in Chicago, in New York, in Maryland, in Florida, as well as in Israel. In Israel, upon graduation, our students would then go into the 2-year stage and then apply for residency. And our students are working across the country in locations such as Shaare Tzedek, Hadassah and Kerem, Soroka, Tel HaShomer. These are top medical world-renowned institutions. We put this up here, so we do not have a typical student. We show this more because we get asked often, what do you need for a GPA or an MCAT score? These are averages. We really, when we say we review our applicants holistically, we do. We ask for distinct essays that give you an opportunity to share with us something that your application does not share. Many of our students, about a third, are not straight pre-med students. They've gone on after graduation to take a post-bac course to get the coursework that they need. And the coursework is pretty much typical of a medical school, with a year of biology, 2 years of chemistry, one of which should be organic or biochem, and a year of physics or calculus and half a year of physics. But that's very typical of medical school applications. What is common amongst our students, whereas there is no typical, what is common is their commitment to service, their commitment to understanding the need for a public health and the world that we're living with in now. Global health, the importance of global health through the last 2 years that we lived is now known by everyone, but we have known that from the inception of our program, incorporating this training into all 4 years of education. Research is, while it is not required, many of our incoming students do complete research work prior to coming. And we have a research requirement. It is not required for to publish your research. However, it is required for graduation to have a research project. Up here, if you want to jot this down, I hope you'll take an opportunity to visit our website. There is a wealth of information on the website. That email that's noted there, we monitor closely. If any inquiries, feel free to reach out to us. We do reply in a timely manner. And the last link here are for blogs. We ask every year for volunteers from our first year class to write blogs for us. They volunteer, they're eager to do so, and they share on these blogs both their academic experiences as well as their social experiences, which really gives you an idea of what it means to be an MSIH student, to be a medical school student in Israel, to be living in Israel, to be immersed in the culture. And it's tremendous insight. You even might see a video too on there. So I think we have time for a quick question if anybody has. Okay, if you have any questions later on, please feel free to reach out to us at the email noted. And thank you for having us again.
Thank you.
Thank you so much, Ms. Coleman and Ms. Chesser. So now we want to introduce the Zucker School of Medicine at Hofstra Northwell, Dr. Rona Woldenberg.
Okay, great. Hi, everyone. I'm Dr. Rona Woldenberg, a Ramaz graduate, a couple of years back, just a few, and the Dean of Admission of the Zucker School of Medicine at Hofstra Northwell. And I'm joined today with 3 of our students, Liat Goldstein, who's in MS4, who's going into OBGYN, and who will be doing her residency in our program at Northwell, and Stephen Gams and Yocheved Friedman, who are both MS1s. And so I ask you, we have a presentation prepared, but if you have any particular questions, please feed them into the chat, and Yocheved, Liat, and Stephen, I hope will be looking at it as well, and we'll try to do as much as we can in the short period of time that you have allotted to us. I think what probably is the most important thing is to understand is we're a small class of 100 students, but we are very dedicated to being a diverse class, and being an Orthodox Jew in our school is no different than any other component of diversity in our school. It's well respected. And everybody is able, and I think Liat can probably speak to it more than anyone, and her husband also actually went to our medical school as well, the respect that is given across the board. So our students really don't have difficulty in being Shomer Shabbos in our school. Because of the small class size, the individual attention, students are very, very much able to maintain their commitment to being a Shomer Shabbos Jew and yet get probably what is the most innovative, cutting edge education that's available right now in the United States. So I'm going to share my screen. I think I have that capability. Yes, you're going to tell me yes, I hope, right? Screen share. And I'm going to try and see my guys. Am I up? Am I up and running? Yes, is that true?
Yeah, yeah, Dr. Woldenberg.
Okay, the only thing I have to go back, I want to stop for a second. I just want to make sure that I have the audio. So let me share again because, okay, share sound, optimize video clip. Okay, now I'm good. Okay, and here we go. We're here. We're sharing. We're big screen. Here we go. Okay, and this is our Office of Admission. Myself, I'm the Associate Dean, as well as a group of fabulous people who are very much involved in all aspects of our process. And Timothy recently joined us, and his picture is not there yet, but he is very much a part of our team. Okay, and hopefully the video will load in a second. I am told that that will occur. It may take a few seconds. And so far, I'm not so good, but oh, I was good before. I even tested it out. Okay, this has become a little bit of an issue. Okay, let's go. Let's try and reload it and see if it comes on. Okay, in the meantime, if not, I will move forward and I don't know why it's not loading. We had the video up here and it was all prepared to go. Okay, if I go forward, I'm going to, if I need to, I'm going to sort of switch a little bit of and give you a little bit of an overview instead. And I apologize for that, but we have a knowledge and action video that was very much involved. I tested it beforehand, it worked, but for some reason I'm having a little bit of a problem with that. So just a little bit about our curriculum. Many of you may know one of the unique parts of our school is that we start the first 100 weeks or the first 2 years with EMT training. All of our students become licensed EMTs in the state of New York. And in addition to that, we have very much a sort of hybrid mode between case-based learning as well as problem-based learning in small groups, what we call our PEARLS curriculum, which is patient-centered exploration and active reasoning, learning, and synthesis. And that's where our patients really learn physiology, pharmacology, pathophysiology, all embedded in a patient, because our goal is to sort of embed the science in the patient to make you very much more capable of understanding and retaining the science that's necessary to basically propel your medical careers. We take a unique approach to anatomy. Our anatomy lab encompasses radiology, encompasses embryology, histopathology, and we sort of fuse it all together, and it is embedded in each portion of our first 100 weeks. So you have an anatomy course that basically spans the whole 2 years, but again, relevant anatomy to each of the different areas that you're learning. And then we embed clinical medicine from day one. We do the EMT training. We do a unique approach to sort of an evolutionary approach to the human body. And you work with 5 different mentors across the first 2 years, one-on-one in their offices. And you really develop your clinical skills simultaneously while learning the science of medicine. Our week, our usual week in the first year and second year, you come in Monday, you get your pulse cases, those cases I talked to you about. So the theme of the week may be anemia, and it'll be an acquired anemia and a hereditary anemia. And then the rest of the week is built around that. We talked about the structure lab I mentioned, which we embed radiology. We embed the histopathology. You have your clinical work that you do. And then you can see here a lot of individual time to prepare, because we're all about you taking responsibility for your own learning as a group. Okay, and we treat you as adults and give you time. It's not classroom time with a one-way transmission of facts. It's you learning the facts at home and coming together to solve problems. And that's the whole goal of our curriculum, is taking an adult approach to learning that you can carry with you for the rest of your career, because as most of you know, medicine is constantly changing, and that ability to be able to constantly incorporate literature, learning into your day-to-day practice is vital if you're going to be a successful physician. Our third year, we have 6 rotations that are required. We also, though, embed selectives, which are just electives done in our health system, to allow you to start exploring whether you want to do ophthalmology, urology, early matches, and really give you time to potentially develop your interest. In our 4th year, I'm sorry about that, I'm jumping a little bit here. In our 4th year, where are we? We're in our 4th year. Oh, now we passed. Okay, here we're having a good time with the computer. Okay, 5 months of elective time. You can bulk them together. Hopefully, now that the pandemic may be sort of in our side view mirror, I'm hoping it's going to go to the rear view, but right now, at least it's in the side view. Elective time, global health experiences. You have any kind of elective you may consider, whether it's research. We have students who do electives with us in admission. In fact, one of our students actually gave a presentation today on a project that she submitted to academic medicine, done in conjunction with our office. So all different types of things that you do in your 4th year. 3 required electives, including emergency medicine, either adult or peds, critical care, some ICU experience, because we want you to be prepared to work in an intensive care unit, whatever you decide to do, as well as an acting internship, medicine, peds, surgery, or family medicine. Okay, as you can see, a lot of different types of hospitals and clinical experiences that are in our health system. We have tertiary care, we have specialty hospitals. As you may know, Northwell is the largest employer on Long Island. We're one of the largest, I think we're the 2nd largest non-for-profit, non-sectarian health system in the country, with 23 different hospitals available to us, a peds hospital, 2 psychiatric hospitals. We have urgent care centers, we have eye and ear centers, we have all different types of clinical facilities. Any type of experience that you potentially want to engage in is available to you in our health system. So the health system is vast, 10,000 physicians, but yet the school is kept small deliberately to make sure that you all get the maximal experience possible within an environment that's non-competitive for those experiences. So I think Liat and the students probably can comment on that, how you can really do what you want to do without having to put elbows out to somebody else, in terms of whether your interest is primary care or subspecialty neurosurgery or ophthalmology. Liat's husband is in interventional radiology. So you can potentially go in any direction that you want without any problem in achieving your goals. We have research opportunities. We have a research program between year 1 and year 2. We have an MD PhD program as well. Students who do our MD PhD program can get their PhDs from either Feinstein or the Cold Spring Harbor facility. Many of you may know Watson Crick, sort of part of your pre-med curriculum. So you can go in either direction. Tons of clinical research opportunities. As I mentioned, our student who worked with us in admissions actually had a medical educational research experience. So a lot of different routes for research if that's your area of interest. As you see, numbers are vast in terms of those who participate in our summer research program between year 1 and year 2. And we have a stipend to help support yourself over that summer because you're not technically in school at that time. And again, non-competitive, everybody who applies for the research program whose research is approved gets the stipend. Again, our current MS2 class, 94% of the students participated in the research program. So a very strong program and strongly supported by our student body. And we do have a specific program, what we call scholarly concentrations. This is our CLAR leadership program. It's a program which you apply in your first year. You get a high-level mentor in the health system. You work with that mentor over the 4 years. A capstone project is part of it, and longitudinal mentorship is very much a part of that program. We also have scholarly concentrations in other programs, medical ethics being one. We also have certificate programs, so a lot of different things you can do. We also have dual degree, MPH, MBA, obviously the MD PhD, and you can do an MD MSED with a master's in science education as well. This is our clinical, this is the primary care program I mentioned. So another potential scholarly concentration, primary care. I mentioned the leadership program and our match list. I think it compares with any of the top programs in New York. We are also tied for Columbia for #1 in terms of diversity, equity, and for our school on U.S. News and Health, U.S. News and World Report. So I would have liked to have shown you our video, but I sort of covered a lot of territory, and I'm hopeful that you will put some questions in the chat, or I put up our email at medicine.admissions. I'll put it up again, and I'll ask my students if they wouldn't mind maybe sharing their emails if any of you want to email them with specific questions. So I don't want to overstate my welcome because I think I'm right on time.
All right, thank you so much. So now we're going to move on to the University of Boston School of Dental Medicine. We have Mr. Joshua Swanson with us. I know we're short on time, so if you're ready to just jump right into it.
Hi, everyone. My name is Joshua Swanson. I'm the DMD Admissions Manager here at Boston University, Henry M. Goldman School of Dental Medicine. When this presentation, I'll be fast as I can reasonably be. I'm going to give a brief presentation. So hopefully, can someone give me permission to share my screen?
Hold on, Claude. I just gave a.
Okay.
Am I good to share my screen?
Yes, you should.
All right. So can you everyone see the Boston University Henry M. Goldman School of Dental Medicine, the red?
Yes. Yes.
All right.
We can.
Cool. All right. Awesome. So I'm gonna get going. So we're located right in downtown Boston, and there are 4 building blocks of our education system. Sorry about this. Unfortunately, every time I do a full screen, the music likes to play. Anyway, there are 4 building blocks of a Gsdm education, community, patient care, and research. Education is very important. We have over 70 courses in biomedical, behavioral, and clinical sciences for the DMD program, as well as 50 courses in behavioral and clinical sciences for the DMD-AS program. Grading is done on a criteria reference base, which means there's no grading on a curve. Everyone is graded based on their own academic abilities. And the Integrated National Board dental examination must be challenged before graduation. And our pass rate is between 90 and 95% on the first try. Patient care is also very important. Carefully sequence and scaffold set of experiences, didactic simulation, and then direct patient care. There are faculty always available to guide and support students, and students learn advanced skills, including digital implant planning, surgical placement of implants, and digital dentures. Students graduate as confident and independent providers. Research is also a major part of BU Gsdm. There are research opportunities in basic clinical, public health, and translational sciences, and research is conducted in multidisciplinary teams. And through the pre-doctoral research program, students learn about the importance of research and scholarship in dental medicine and are mentored on research career opportunities. And DMD students in our school have opportunities to get involved in research from the first year. Of course, community is also very important. The GSDM's mission, numerous opportunities to give back are out there. Some are part of the formal curriculum, others are on a volunteer basis. There is a day of service during orientation, and there's also a pediatric Boston Public School rotation during the 4th year. Also, too, we have oral screenings and oral health education at area preschools, daycare centers, community events, and so on. We also, before COVID, had international travel opportunities, including international service trips, as well as service trips to the Native American reservations out west and the Inuit communities in Alaska. We are hoping to get them going again in the next year or two. So, of course, the big question is what makes us different from other dental schools? So I'll briefly go into it. First and foremost, it is our students and faculty who make GSDM education so special. We have over 800 pre and postdoctoral students, and on average, over 20 states are represented in each DMD class. And on average, over 25 countries are represented in each class. That's both the DMD program, the 4-year program, and the 2-year DMD Advanced Standing program. We have over 20 student organizations. As of 2020, we had 292 faculty, and about 30% of them are alums of the DMD program. And we have over 8,000 students, 8,000 alumni around the world. A big part of our program is the group practice model. 2 group practice leaders oversee the school's 9 group practices. They instruct, evaluate, mentor, and model the doctor-patient interaction, teach presentation of treatment plans, and advise their pre-doctoral students in all phases of patient treatment. Besides them, there are also general supervising faculty. These are specialty faculty who also supervise treatment and provide hands-on instruction at every clinic session. And many members of our admission committee are involved in the group practice program. So if you apply to our program and get interviewed, a good chance that one of the people interviewing you is involved with the group practice. Why do we have the group practice model? It simulates real-world experience, provides roster of patients that ensures students develop complacency with a full range of required treatment experiences. So basically, a common question I get is, do we have to find our own patients? The answer is no. The patients are assigned to all students in the clinic. Obviously, if you have a beloved parent or grandparent you want to treat in the clinic, we can make an arrangement, but otherwise, students do not need to worry about finding their own patients. And also, too, ensures consistent faculty members for guidance, mentoring, and feedback, as all students are assigned to a group practice from day 1 of the DMD program. Another major part of the DMD program that we're very proud of is digital dentistry. Digital dentistry uses digital or computer-controlled components to support patient treatment, and this involves a 3D printer. We also take 3D images of patients' teeth and jaws using a cone beam computerized tomography to diagnose and prepare a treatment plan. So why is digital dentistry important? It makes dental procedures more efficient, more consistent, more accurate, and more cost effective, important for both practitioners and their patients. And there's also an increased demand for such procedures for which digital dentistry technologies are well suited. And BU Gsdm was one of the very first schools in the country to have a digital dentistry program. So how will you learn digital dentistry at Gsdm? Students are exposed to digital dentistry technologies from day one. And current students say this early exposure increases their confidence and comfort level. In the clinic, students use the latest digital dentistry technology to deliver under faculty supervision the highest quality care to patients. So we continue to push technological boundaries. In 2019, we became the first dental school to acquire, install, and use 2 surgical robots for dental implant surgeries. And in 2020, we installed a carbon 3D printer, a large-scale printer capable of printing up to 20 dental models in as little as 2 hours. And I have seen it in action. It is actually a pretty neat thing to see. Also, too, we have a brand new facility that started in 2018 that was completed in 2021. We had our ribbon cutting ceremony last year. The new faculty is state-of-the-art. The clinical space was increased by more than 60%. Pre-doctoral students now have access to 100 patient treatment spaces, each equipped with the latest state-of-the-art technology. We also have a brand new simulation learning center located in the dental school building, which is equipped with cutting-edge simulators. Overall instructional space increased by 40%, including 140-seat new auditorium-style classroom. So some pictures from our new updated facilities. And finally, one thing that makes us stand out, with all due respect to my New York friends, Boston is an incredible city to be a student in. We are home to over 36 colleges and universities, vibrant arts and culture scene, including the Museum of Fine Arts, the Isabel Stewart Gardner Museum, and the Museum of Science. We also are home of the nation's oldest park, the Boston Common, and we are the economic hub of the New England region. Top industries include healthcare, alternative energy, and technology. So hopefully that gives you a good overview for the DMD program at Boston University. Just a couple other quick things. We see every year 115 students into the 4-year DMD program. The application cycle starts up in June. I start reviewing applications in July. And even though I have no say who gets interviewed, part of my job is to bring to the attention of the admission committee strong qualified applicants. So if you are interested in our 4-year program, it's always best to apply early. And also too, it's best to email me any questions you may have, even just to make sure that your application is complete. Because first of all, I can make sure your application is complete. And if not, I'll tell you what's missing. And also too, if you're a strong competitive applicant, I can bring you to the attention of the admission committee. And what I'm going to do in a couple of minutes is I will enter in my email. So that way, I know my time is very brief here, but I just want to make sure you have access to email me any questions you have. Please email me anytime. If the question pops in your head, 8 o'clock on a Sunday night, still email me. I'll happily answer it the next business day. And that's pretty much it for me.
Thank you very much, Mr. Swanson. Up next, we have Toro College of Osteopathic Medicine. We have Mr. Stephen Toplan with us. Mr. Toplan, ready?
Yeah, I'm ready. Can you make me a code so I can share?
You should be good.
All right. Look at this. Good evening, everyone. My name is Steve Toplin. I happen to be a graduate of YU back in the early 90s, and I'm now the director of admissions at ToroCom. Our campus, my campus is in Harlem, but we also have a campus in Middletown, New York. So basically, first I want to talk about what are differences between MDs and DOs. If you're thinking about going to medical school, this is an important conversation you have to have with yourself. You have to figure out what's going to be the best path for you, because there are a lot of similarities between the two paths. The degrees are accepted in all 50 states and many countries around the world. You're going through the same residencies. You're going through the same match process. And so therefore the difference is going to be in how you treat a patient. And so when you're going through the process and you're shadowing, I highly suggest that you shadow both the DO and an MD just to figure out and see what the differences are in person. So here's some things to think about while you're going through this process. How does an MD, an allopathic doctor, alleviate or treat patients? alleviate symptoms. Their main modalities are the physical lab work, imaging, and their treatments often are drugs, therapy, radiation, like chemotherapy, surgery. But DOs do all that, but they look at the body slightly differently. They look at it as an entire unit, and often they're asking, what can the body do for itself that it's going to heal itself? Most people go through their lives, when they get a cold, the body eventually heals itself without much intervention, save maybe some over-the-counter medicine. So when something is more serious, the DO is going to try and figure out what can the body do to help that person. And here are just two brief examples. How would an MD treat a swollen knee? Right on the screen, external exam, X-ray, cortisone, physical home therapy, OTC pain. But a DO, what would he or she do? All the above. But they'll also look at how that knee connects with the rest of the body. Because guess what? If you've been walking around with a swollen knee, going to put pressures on the rest on your hips and other joints of your body. And we're also going to figure out, is this because of a disease? Is it because of an injury? And also, the lymphatic system of the body is one that helps drain the fluids in your body. And so there's swelling, that means something's wrong with that entire system. So they will work on that. Another example, how would an MD or DO treat asthma? Again, the MD, external exam of the lungs, medications, discuss home environment, very, very important. And also look for other illnesses that might be going on all at the same time. But what would a DO do? All the above. But also, if you think about it, the asthma is a problem with your lungs. So there's and the lungs are swollen. So what's impeding your lungs from functioning properly? Well, you have to have this thing called a rib cage around the lungs. And so therefore, the DO is going to try his or her best to loosen that connection, to help increase the breathing apparatus. Also, there's swelling. What can the body do naturally to open up those airways? So sometimes people wonder, well, if I'm an MD, what can I do? If I'm a DO, what can I do? Well, there's just some of the areas that MDs can specialize in. And guess what? DOs can specialize in the same areas. There's absolutely no limit to what a DO can do versus MD, right? Because they're certified and they can be trained in any field whatsoever. Now, what makes Turocom unique and different? First and foremost is how we deliver our information to the students. We use the flipped classroom model. So instead of being in lectures for hours and hours and hours every week, you're watching lectures on your own time. It's a lot of independent work. But when you come to the classroom, we do our best to make sure you know that information. These eye clickers, your best example, or that you might be familiar with, is the Zoom poll. If you've ever been in a Zoom class over the past 2 years, if the teacher uses the poll, great attribute of that poll is you get instant feedback. And so we do this in the classroom itself. Our focus in the classroom is to make sure you know the information, because that's how you're successful in medical school, making sure you know the information. And another hallmark of our education is that we don't have competition in the classroom. How do we do this? We do this because we have a Z-score as the basis of your letter grade. The Z-score is a statistical method where your grade is based on people who used to be in the classroom over the prior 3 years. So everyone in the classroom is after the same goal. Their classmates, the teacher, they want you to be successful. And they're also the second and third year students who will help you out any problem. And so therefore, another advantage of the Z-score, a little hard to explain or conceptualize, but unlike a standard grade bell curve, everyone in that class can earn an A because it is not based on a standard bell curve. And also because we use the flipped classroom model, we are able to condense the bulk of our class time to Tuesday, Wednesday, and Thursday. Mondays is reserved for testing. But obviously, if there's Yom Tov or Yom Tov on a weekday or Yom Tov ending on Sunday, you're never going to have a test on a Monday. But this is a typical weekly schedule. The only class you ever have on a Friday is your second year 1 semester course called the Sim Lab. And two things you want to consider when you're choosing which medical school to is how well do the students do it in the standardized tests, in any DO school they're taking the complex. And last year we had 100% first-time pass rate on level 1, and the year before on the level 2 we were 4th in the nation for first-time pass rates. So our students are doing exceedingly well on these exams. But even more important than the exam is how our students match. So this year we had a 99% match rate. Last year we were 100%, and 18 through 21 we're hovering in that high 90% mark. Just keep in mind that this is well above the national averages. The national DO and MD match rate last year was 78% the year before, and the match rate last year for DOs was about 89%. So we are exceedingly successful in both the complex exam as well as matching when students are finishing up. Now, I want to introduce to you Adara Liss. Adara, are you on?
Yes, I'm here.
Hi, Adara. So Adara is your second year student, right?
Yes.
Yes. So Adara, introduce yourself, talk about Torocom, and it's your 60 seconds.
All right, sure. So I'm Adara Liss. I'm originally from Boston, went to Aroza for seminary and then Stern College where I majored in biology. I then spent 2 gap years working as a lab technician in the biology department at Stern and then started medical school at Torocom in the fall of 2020. So I'm currently finishing up my second year. What I most love about Torocom is something that Mr. Toplin mentioned, that the class is so incredibly supportive and collaborative. Everyone just helps each other out and it's a really warm environment. We're not graded against each other, so that eliminates any competition within the class. And I would say that's definitely a hard thing to find in a medical school. I also really enjoy learning osteopathic medicine, and I've really quickly come to appreciate the value of it. We learn to take the full patient into account and not just focus on a specific set of symptoms that they're presenting with. And it's really amazing to practice the osteopathic techniques that we learn in the classroom on different friends and family members. They always appreciate any techniques being practiced on them. And it's very clear you can very easily see the effect that you have on them, like almost immediately just with one technique. So far I've really been enjoying my time at Turo and learning osteopathic medicine. And if anyone has any questions at all about Turo or about being pre-med at YU, feel free to reach out.
Okay, and just also food for thought, not every student goes directly from college into a medical school. Sometimes the students pursue a master's degree. And one of the great things about the master's degree at the Torocom partnership is that if you finish our master's degree with a 3.45 and pass the comprehensive exam at the end of the year, then you have a seat waiting for you in the next DO class, which is really, really advantageous for some students. We've had Lander students and YU students go through this path. Really can be successful if you're not successful in getting into medical school the traditional route. And even though obviously this presentation is via Zoom, both of our campuses in Harlem and Middletown are fully open, and you can always come and visit us. Obviously we're closed on Friday early, so the tours are typically Monday through Thursday until about 4 o'clock. On Friday, our last tour is about 12:30. But we're here for you. And if you have questions about the medical school process, we're here for you as well. And that is it. And if you have any questions, you can put them in the chat. Okay, go on to the next. Thank you very much, Elazar.
Thank you very much, Ms. Toplin.
So we would like to now introduce Rutgers Robert Wood Johnson Medical School. Is Ms. Copeland on the call?
Yes, I'm happy to be here. Thank you for having me. I will do some slides. No, I can't. Tara has to on-share, and then I could do some slides. I'm sorry.
There
Thank
we go.
you.
Sorry about that.
Thank you so much. And then hopefully have time to answer some questions. So Robert Wood Johnson Medical School is located in central New Jersey. We're in the Piscataway, New Brunswick area on the campus of Rutgers University, the main campus. We use our educational mission statement both for thinking about and designing our curriculum, but also in thinking about how we're recruiting our students and how we're screening our applicants as they come through. So we're looking for those pre-professional competencies that AAMC talks about. So we're going to look at your experiences, want to see that you have some communication skills, that you've had some teamwork skills, that you're sort of interested in pursuing sort of education, but also that desire to learn, that continuing improvement and growth mindset. Our school is probably best known for our students. Our students are really supportive of each other. They're very collaborative. I love my students. I don't think we could do admissions without my student ambassadors helping me with that. Our faculty are very passionate. They're really engaged in improving the educational process. We have many student interest groups. They run from sort of wellness groups like the Miles for Smiles, which is a running group, to obviously the career specialty interest groups as well. We have changed to a curriculum, which I'll talk about next, but the first pre-clerkship portion of the curriculum is still pass-fail. We have an amazing match rate. We're very proud of our students with that. We do offer dual degree programs as well as some distinction programs where it's a little bit like in your certificate, but you get a notation on your transcript to say I specialized in, maybe it's medical education research or bioethics or diversity, equity, and inclusion. We have 8 different distinguished programs. And we also, our students are very committed to serving the people of New Brunswick and the surrounding communities in New Jersey. This year is our first year of our new curriculum. We have a 5 C's curriculum where we've tried to integrate sort of shorten and compress that pre-clerkship curriculum, but also integrate the courses. So our thinking is that if we can give you the normal and the abnormal at the same time for our assistance-based courses, that's going to help increase your critical thinking and curiosity and really help to make those connections earlier. Our clerkships will begin at the end of the 2nd year. You're going to have time for research and service, and then a lot more time for career exploration because your 4th year starts earlier. So it's longer than a year. We do have a new 3-year track. This is a program, 3-year medical school program designed for students that know they're interested in family medicine. So you're going to be going through this 3-year program to connect to one of 2 family medicine residency programs. So as I mentioned, we do choose our students based on pre-professional competencies. And so when you're thinking about your experiences, it's not only what you valued and what you're passionate about, what you spent time on, but also ones that are able to reflect and demonstrate that, yes, I've developed these competencies coming into medical school. Being in New Jersey, we do have a lot of languages represented in our class. I think at least 70% of our students speak another language, and 50% are fluent in at least 2 languages. We are a heavy female school. There was one year we were 50-50, but otherwise we tend to be more heavy on the women. Fairly young, 23, but 25% of my students have graduated at least 3 years, if not 10 years ago, and 25% only are coming straight from undergrad. We do have some minimum thresholds. We do require a cumulative undergraduate GPA of a 3.0 and an Mcat of 498. But we do look at the full range. We are going to do a holistic review once you've met those minimum thresholds. Trends can be important, the use of resources, what you're passionate about, what you're interested in, all of these things are valid. And that is my very quick presentation. So I will take questions if anybody has questions.
I guess, can you describe your MD PhD program?
Yes, so our MD PhD program follows that traditional model. If you're going to do the pre-clerkships curriculum first, and then you're going to go off for your PhD study and then come back to and do your clerkship and your advanced clinical experience. We do suggest that our students in the MD PhD program do their step 1, their first licensure exam prior to going off into their PhD work. The unique things about our MD PhD program is, number 1, we do have an an agreement with Princeton University. So if you want to do your PhD at Princeton in the basic sciences, you can. We also have a lot of different disciplines in which you can get your PhD. So we have students pursuing a PhD in anthropology, engineering, biomedical engineering, as well as sort of your more traditional molecular biology, neuroscience, and so forth. In the interview process, you're applying directly to that program, so you're going to be interviewing both the PhD faculty as well as through the multi-minute interview that the medical school does.
Thank you.
Any other questions?
I guess a follow-up question that maybe many people may have is, what's the ideal applicant?
So I think there are two things in particular we're looking for. So we are definitely looking for that clinical experience, that you know what you're getting into, that you're passionate about medicine, as well as the service experience. We do think it's a service-oriented profession, and we want to know that you have that perspective and values. But to the experiences, the two things we're really looking for: one, we really need a student that can carve their own path. And so we have a lot of people that are really helpful and want to mentor you, but we need the student that's going to go ask for it, that's going to say, you know what, you're doing a really interesting project. Can I help you out? So it's trying to find the student that has, in their application, they've demonstrated some interest in something. And it could be anything. It could be academics, or it could be some of your extracurricular that you've stuck with over time. And it's okay to change and to have a variety of things, but we need a little bit of that growth mindset, of that you found something you're going to improve on and stick with. And I forgot. Sorry. I think that's what we're looking for. I think the other piece is that collaboration. Our students, and I think we do see it sometimes through experiences, but it's really important that they are supportive of each other. They thrive in the environment when they are reaching out and willing to work with others, already have a little bit of teamwork skills, and really they don't have to be extroverts, but they definitely have to be able to make connections with other people.
I have a question. I might have missed it, like missed what you said. In regards to the MD PhD program, how does it work in terms of combining like the research and the medical school together?
So you are going to do your PhD separately from the medical school. And so you sort of split your medical school curriculum in half and then go off and do your PhD. In your last year of medical school, you are able to do some things that helps to integrate sort of your research knowledge along with practicing medicine, as you're figuring out whether you're going to go into a residency program or whether you're going to go straight for research. But it's definitely for people that really want to combine both of those degrees.
I just had a quick question. Sometimes students ask me, if they haven't heard back from a school, what is the protocol of how far they should not push, but how assertive they should be in terms of follow-up? They haven't heard that they've been accepted, or they haven't heard that they've been rejected, right? Or they haven't, I guess their application must still be in the review process. So I always wonder, what would you advise students in terms of how assertive to be in follow-up?
I think it is a very fine line. I agree. We are open to updates. So I think reaching out to schools, sometimes in October, November is a good idea. If you still haven't heard anything, then reach out again in December or January. We try to communicate our decisions by March. So this cycle, all our decisions are out. Yes, they're all out now. So it definitely, in March, if you haven't heard anything, then you can definitely follow up then, but you should have heard something by March. And so I think reaching out earlier makes sense. I agree, you shouldn't reach out every single month, but I think twice in the cycle and spacing it a little bit is perfectly acceptable.
Thank you.
Yep. And oh no, we still have 3 minutes, I think. Is there any other questions?
Can you give some information about your residency matching statistics and things like that?
Yeah, we have been above the national average for at least the last 10 years and probably more than that. Our students go across the nation and they also go to very many different specialties. So sometimes there is a feel for a class. Like some years we may be heavy for anesthesiology or heavy in a surgery subspecialty. Some years we're a little heavier on primary care. I never know what drives it and why there's a difference, but we're always matching across specialties. There are many specialties represented in that match. So this year we were at 97% of our students matched, and two really great residency programs. So they are really good.
One other question is that you mentioned that you, in looking at applicants, you really do look at how committed they are to the population you serve. I think that's one of the things that you mentioned.
So it's more service orientation. We do have a lot of different populations. We have the benefit, like New York, of being in New Jersey, where there are many populations you can serve. So we do have a commitment to the local community, but what we're looking for in applicants is that service orientation, that you've been off campus, you've interacted with others, that you have a desire to help those in need. I wouldn't say there's one particular population that we're looking for in terms of who you're helping. It's more that you have that value of wanting to help others. And I lost track of time, but we probably, yep, we are there. So I think the next.
All right, thank you. So we'd like to move on to Touro College School of Dental Medicine. We want to introduce Margarita Diaz. She's going to present for us. So if you're ready to go.
Hello, is it okay if I share my screen?
Yeah, please go ahead. I think we made you co-host also.
So just a little bit about, can you all see my screen? Okay, great.
Yes, we can see it.
Okay, great, thank you. So a little bit about Touro College as a whole, or actually Touro University now. We have approximately 19,000 students as a whole, 4 medical schools, including the campus that the dental school shares a campus with, New York Medical College. We have a bunch of PhD programs, doctorate programs. The leadership for the dental school, Dr. Ronnie Myers is our dean. Dr. Edward Farkas is our vice dean. Dr. Yankowski is our assistant dean for academic affairs. James DeMayo is our senior director of admissions, and me, Margarita Diaz, I'm the admissions coordinator. I coordinate all aspects of interview season, including gathering interviewers, helping to select the applicants, and setting up interviews. The application cycle for the dental school, as with all dental schools, starts June 1st and ends February 1st. Grades and DAT scores are of high importance, but we also look at the application as a whole holistically. We look for things like employment experience, community involvement, and of course, professional activities. These are just some of the statistics for our school in terms of applications received, students interviewed. More importantly, the most previous class, the class of 2025, the average GPA for that class was a 3.6 overall, 3.4 in the sciences. Our average DAT for that class was a 21. We are becoming more competitive as the years move on. The dental school is a relatively new school. We're working on our 7th class now. 56% of the class was from New York, and 69 undergraduate schools were represented. These are just some of the clubs on campus. Too many to read off, but here you go. So what makes the dental school a little bit different from other schools? Right now, we don't have any postgraduate programs, although that will change this year. We're actually opening up our first specialty program in orthodontics. We do have a highly advanced technology component to our school. The school has spent millions of dollars into the clinic and pre-clinic. And because we're under Jewish auspices, that of course you guys all know what that means because this is Yeshiva University. So that's just what makes us a little bit different from other schools. This is just a picture of a D1 student in the simulation lab. So students that are in their first and second years, they're primarily in the sim lab and taking their didactic courses. And then once you're in years D3 and 4, you're in the clinic working on actual patients. If you're a D3 student, you are assisting a D4. If you're a D4, then you have a D3 student assisting you. That's just a nice picture of Dr. Jankowski and a happy patient. A little bit about research for the dental school. Students after their first year of dental school, they have the opportunity to conduct research through our summer research program. It's an 8-week-long program where you get paired up with a research mentor. Students will get 2 weeks vacation. They'll get a $2,000 stipend. And then at the end of the program in about early fall or late fall, they get to present to the entire school what they conducted, what research they conducted. And it gets put on your transcript as well. This is just a picture of our 4th floor testing center. With that, I will, I know this was short, but I wanted to leave time for some questions if anyone has. Do we have anyone here interested in going to dental school?
Yeah. I was wondering if you could go through the schedule of what goes on D1, D2, D3, D4.
Sure. So like I said,
depth.
Sure. D1 students, D1 and D2 students start off taking didactic courses. So you're in school primarily 9 to 5, Monday through Friday, although Fridays are short days. What those classes are, I can't tell you because I'm really not sure. And then once you're D3, you're working in the clinic, working on actual patients.
Thank you. I mean, also I was wondering, I know that you spoke about how Touro was a Jewish institution, about like what holidays you guys give off compared to like other schools.
So we observe all the major Jewish holidays. You know, Pesach coming up, you guys get I think a week off. Shavuos, of course, Yom Kippur, Rosh Hashanah. And then Fridays, you're hardly there. If you have classes, they'll probably be on via Zoom. But Fridays is relatively a short day for us at Touro.
Margarita, I know that in general, research is not part of a dental school application requirement. But if one does that, like, would you say that would be something that would make somebody stand out? Or are there specific things, again, that you think would make a candidate stand out from amongst other applicants?
Yeah, so research is not required for us. It is recommended, but only if the student is really interested in doing research. We would like to see that. on the application. I think that primarily what stands out for us, to be honest, is of course high GPA, high DAT. You want to at least get your foot in the door, and you really have to focus on your studies. Taking all your prerequisites, you can apply as long as 75% of your prerequisites are completed. However, we do recommend finishing the majority of those prerequisites before you take the DAT so that you can be in the best possible position to get a really good score. I think those two things is what really stand out for, students is of course high DET, high GPA. Of course, we do look at the entire application holistically, but you are competing against 2,400 other students who are submitting an application for only 114 spots.
Thank you.
Sure.
I know also you guys you emailed me about the program you have in the summer. If you could talk about that as well.
Yeah, so unfortunately, the deadline for that program was March 1st. So it's too late to apply now, but I can tell you, for next year, if anyone is interested, it's a 4-day long program in the summer, usually the first week of June. 9 to 5, meals are provided. It's primarily for students who are on the fence of going into dentistry, or students that really just want to learn more about dentistry and learn more about Toro. You get to do some dental work on mannequins. You get to meet with current students. You get to meet with some of the faculty, and then at the end, we make an admissions presentation on if you want to apply to dental school, these are some of the things that you should really be doing. So it's an excellent program. I encourage anyone who's interested in dentistry to apply, but for next year, because it's too late for this cycle, unfortunately.
And what is the percentage of students who are international students who are accepted into your program?
Oh, wow. International? I want to say maybe like 5%. But we don't have a cutoff or a minimum requirement for that. It's just worked out that way, but very little a percentage of our students are international students. But we welcome international students to apply, of course. They would just need an I-20 visa and do the whole international process. Can I share my contact information in the chat?
Yeah, please do.
Okay, great. If anyone has submitted an application or has gotten a rejection from us and wants to go over an application just to see how they can improve for the next cycle, I'm happy to set up a time to do that if anyone here has done that.
So I guess, all right, I guess. So if anybody else has any questions, they'll email you.
Sounds good.
All right,
Sorry.
I think that wraps it.
Guys.
Thank you so
Thank
much.
you for having me. Sure. Take care.
All right, so next we have Richard Antudia from NYU College of Dentistry. Are you ready to present?
Yes, hi, how are you?
All right, so if you want to get right into it.
Yeah, so actually I don't have a sort of typical presentation. I think one thing that I always like to do is just answer questions if there are any questions about our program. In general though, I know that you've heard from a few dental schools, and I think our processes are very similar, right? We do accept applicants through the ADIA ADSAS application. The process starts in May with a soft opening. You can start your application process, which actually gets submitted in June. we typically will start our actual review process sometime in July or August, send out interview invitations from the month usually of October until March or April. Our process is pretty extended. We do have the largest dental class in the country. We definitely are transparent about that. We have an incoming class, generally about 380 students, give or take, depending on any students that may be returning or what have you. But again, typically around 380. And again, the ATSAS process is pretty straightforward. Once your application is complete, that is when we can start the review of the application. So if any of you are going to apply, don't have DATs, anything like that, that's fine. We can start the process, but we won't be able to review the application until your application is complete. Once that is done, again, our process does tend to be more extended because of the size of our program. So one thing that I always try to explain to students is have a little patience with us, especially because we have such a large class, incoming class, and our process is a little bit more extended. I know that timing is important for many schools, so you have to apply early and get all your materials in early. One thing that I always mention is that for us specifically, if you don't have your DATs in June, July, August, that's not late for us, again, for us. Obviously, I know that we're not the only school that people are going to be applying to, but that is something to think about, especially if people want a few more weeks, months, maybe to take the DATs. I always say if your DATs for us come in by the early fall, September, October, even then, that is still early enough for us to really be considered and even possibly be interviewed and get a decision by December 1st. Again, specifically in terms of our program, we do have a large class size, but I always want to explain to students, we also have a really large patient pool, fortunately. One thing that we tout is the fact that we have generally year in, year out, roughly 300,000 patients that walk in through our doors every year. Fortunately, because of that, we do need and require the amount of students that we have. Our third and fourth years are the ones who work directly on patients. First and second year, much like other dental schools, it's didactic. First and second year also, though, you will start your preclinical labs. Your hand skills start generally from within a month of being in dental school, if not even a little bit sooner. So for us, it's very important that the 4 years you start to develop your hand skills from day one. And again, the clinical care and the aspect of that begins at the end of second year, goes into third and fourth year of actually working on the patients. I can actually add one of our links to the chat also. This is just our DDS information, but there's also an open house this weekend on Saturday, which will be a little bit more of a formal presentation. We also have a student panel that we're going to have. I think it's going to be 5 to 10 students, and we'll mix up anyone who shows up into those groups. But we want to give you the opportunity to talk to students as well, not only get our perspective about the program, but the actual student perspective. And there's also a link there to do virtual visits. So if you wanted to discuss anything about your specific application, I know that in group settings, sometimes certain questions may be a little difficult to talk about. You can set up a one-on-one conversation with one of us on the admissions team. So you can feel free to do that. Like I said, I don't have a presentation, but I'd be happy to answer any questions about our process. Again, I do know that dental schools have a very similar process, but there are nuanced differences with applying requirements and other sort of aspects of it. So I'd be happy to answer any questions if anyone has any.
I actually have a question.
Yes, please.
If someone is put on a wait list, what do you suggest a student? I know it's a complicated question.
Yeah. No. It's completely fair.
What would you suggest a student do to help move the process along?
Yeah, it's a very fair question. From my perspective, one thing that I try to always convey to students is how competitive this process is, and not only for them trying to get a seat into a dental school, but for us trying to get competitive students. The reality for us is that we go after students that we know are going to be applying to multiple schools, possibly get multiple opportunities. And we are one of the options. Because of that, we do rely on our wait list. We actually do. I always say when you get on a wait list in certain schools, you know that there's no opportunity. For us, we don't believe that that's the case. It's just competitive. So when students go on the wait list, we always encourage them to contact us. I warn every student though, that's our process. Don't contact every dental school because every dental school has different wants and needs and different ways that they do things. Some schools will not want that contact because they're swamped with other types of work. Because we do have a large class size, because again, we are going after competitive applicants, it helps us to determine who's really interested in NYU. I tell students all the time, even if they're just applying, drop an email. Let us know, hey, I'm really interested in NYU. Even going to one of our events, showing up at a recruitment event and emailing us. Those are the type of things that as we review, we can look at and make a distinction. Here's a group of students that just applied. We've never heard from them. We don't know. And then here's a group of students who have contacted us, have reached out, have shown some interest. Maybe we can look at them a little bit harder. And then even more so on the wait list, same thing happens, right? We have some students who get on the wait list. We won't hear from them. We have no idea if they're very interested, and they could be as interested as anybody, but because we don't hear from them, we don't know. Sorry, there's a storm going on. I don't know if it interrupted the audio. But again, primarily for us, contact, communicate, let us know you're out there. We have a very lengthy process, and we go through the wait list anytime between, December 2nd, once students start to get admitted, until right before orientation. Obviously, that's not ideal. We don't want to pull anybody super late and make logistical nightmares and things like that. But I can tell you right now, we are starting to look at the wait list. So if you have students that you are working with who are very interested, honestly, just tell them to reach out. And it doesn't have to be a daily occurrence. It doesn't have to be a everyday thing. Because
You
there's also
just
that
anticipated my question. How much is too much? No, truly. You just anticipated my question.
No, it's true. And it's a common occurrence, right? And I think that's why I mention it, because how much is too much, how much, or how much contact makes us start to think there's too much intense conversation or whatnot. I always say you don't have to call us every day. Once every few weeks is fine. And if you want to do it every 2 weeks, just put it on your schedule. Drop an email. Hi, I'm still out there. I'm interested. It doesn't hurt. We don't look at that as a negative thing. But yeah, when it starts to be too much and a concern, it can be a concern, and then it becomes a negative, right? This person's a little too, interested. But those are just sort of the reality. But yeah, I always say every few weeks is completely fine.
Thank you very much. That's helpful.
Can I ask a question?
Oh, you can go before me, sir.
Oh, sorry, I didn't see that.
No,
Okay?
no, by all means,
All right.
please.
Several years ago, this is the pandemic.
I'm sorry, you're breaking up. I don't know if that's just me.
Dr. Lowy, you're breaking up. Dr. Lowy, you're breaking up.
I know, I can't help it. It's my internet connection. Can you hear me now?
Yes.
Okay. There was an opportunity for our students to volunteer in the dental clinic. And a lot of our students took that opportunity. In fact, I can't remember the name of the even and the students appreciated it even before that opportunity was not available anymore. Do you
I'm not catching the last part of it. Sorry.
Oh, I'm sorry. I think it's something's like, it's windy outside, whatever.
Yeah, there's a storm going on here too. So
Right, so I think
understand.
it's my internet. I was just wondering if did you hear my thing about students volunteering?
Yeah, I heard
And
that part. I
even
didn't know
before the pandemic, somehow it got fewer and fewer opportunities, and our
Yeah.
students really liked it. And your dental, the feedback I got was they were appreciative of our students. Do you
Yeah.
know any way to start that?
Well, you cut off again, but I think I can go on. I think that for us, actually, one of the things that happens, a lot more regulatory enforcement has started to take place. And because we are a medical facility, our clinics and buildings are basically hospitals providing dental care, we're very limited in the amount of people outside of the school, people who are not covered under insurance and sort of other regulatory areas. So we've had to limit that. And we've actually also started to use our first and second year students for a lot of the shadowing and assisting work, just to expose students a lot earlier, because in the past, our first and second year students didn't used to provide shadowing and assisting, but now as part of their learning, in order to expose them earlier to aspects of dentistry in the clinics, they've actually started to take that up too. So that's also limited the outside opportunities, unfortunately.
Yeah, you used to have this mobile clinic that used to go to, and our students like to volunteer with that too, but I guess that's not available anymore to them either.
Like I said, I know that because of restrictions, because of again insurance and coverages and things like that, that there's been a lot of sort of limitations put on those things. When there are opportunities, we try to notify everybody, but it's been very, very limited and scarce, unfortunately.
Thank you.
Sure, no problem. Aaron, you had a question?
Yeah. So I heard there's a perception ability section on the DATS, and I also heard that it's not factored into the cumulative grade.
Right.
I just want to know how you guys look at that and how you guys factor that in when you're looking at applicants.
Yeah. So I always say all the sections are important. You know, we want to look at all the sections. We hope that they all come out equally well. You know, when someone asks us what's the competitive average, we tend to say 21, and we just give that one answer. Hopefully everything's 21 across the board or higher, but generally we know that it won't be. Certain sections we value a little bit more, and not to discount PAT or QR or any of the others, but for us, the most important ones are academic average, total science, and reading comprehension. Our competitive incoming DATs is about a 21. The closer you are to that in each section, the better. But if you had a 17, if you had an 18 in some of the other sections, that's not necessarily going to prevent you from getting an interview or even admitted into the program. We do review holistically, so we're going to look at every aspect and everything. If everything else is solid, one lower score on one section is not going to, you know, hurt your chances too much. I always say, if anything, if you think that there are areas that are a little bit lower, maybe you're waiting throughout the process, maybe you haven't gotten an early interview, sometimes that impacts that. We might not look at you right away. We might not call you in for a pre-December interview, but it doesn't mean that you're not on our radar, but just not as early possibly. But again, it kind of depends how low you go. I always say the closer you are to that 20, 21 range, the better. The farther you drop off, it can get a little concerning, but again, 17s, 18s, not too much of an issue. Even a little bit lower, I don't want to sort of make it a cutoff because there isn't, but we'll look at the rest of the application, your academics on that.
Perfect, thank you so much. Also,
Thank you very much. Guys, we're running out of time.
Okay.
Go to the next person already.
Sure, no problem. Sorry about that.
You could just drop your email.
Yeah, please.
Oh, sure, not a problem.
All right. Thank you very much, Mr. Richard. Now,
not
next
a problem. Thank you.
We have Rowan University School of Osteopathic Medicine up with Mr. James, Mr. Nigel James. Mr. James, are you ready?
Yes. Good evening, everyone. I apologize. My lighting is really bad in here. So I'm going to go ahead really quick and share my screen. I apologize. Looks like it's taking a little while to load. So again, my name is Nigel James. I'm the Assistant Director of Recruitment and Outreach at Rowan SOM. And I'm just going to run through a really quick presentation. So again, I'm not necessarily going to cover everything. I'll leave my information in the chat so that students can reach out to me, schedule one-on-ones. So let's dive right in. So the mission of Rowan SOM is to develop clinically skillful, compassionate, and culturally competent physicians from diverse backgrounds. We use our mission to help guide pretty much everything we do, especially in our admissions process. So Rowan SOM was founded in 1976. We're not a new school. We were actually under a different name for many years. We were part of the University of Medicine and Dentistry of New Jersey. We were one of 7 schools of health professions in the state. And back in 2012, there was this restructuring act, and we were actually placed with Rowan University, which is in South Jersey. The other medical schools went to Rutgers University to the north. We're the only DO school in the state of New Jersey. And to give you an idea of where we are, we're at 20 minutes from Philadelphia, about 2 hours from New York City. So I Rowan SOM, we do have over 3,000 graduates that practice, over half of them practice in New Jersey. We have a competitive match rate in 2020 was 100%, 2021 and 99%. And the most recent match that took place, we had a 99% match rate. We also offer a pretty unique model, an academic clinical research model. And what I mean by that is that, while attending medical school on your medical education campus, you also have literally steps away a clinical practice that sees over 250,000 patients a year. In that building as well, your simulation center is in that building, your OMM labs are in that building, as well as some rotations can be done in that clinical practice. We are also part of a large graduate medical education program. So we do offer quite a bit of specialties and different residencies as well. So it's, again, a really unique model in that you're able to see yourself kind of like a 360-degree view as a medical student. We also have on our campus as well, Graduate School of Biomedical Sciences, where students can do their PhD or their master's. We're also a leader in research. So Rowan University itself is the 4th fastest growing university in terms of research. And the School of Osteopathic Medicine actually accounts for over 30 to 40% of all of the funding that actually comes into the school. We also offer dual degree programs for students who might be interested in pursuing their PhD or their JD or MPH program. Not a lot of students, of course, do those dual degree options. Med school is already long as it is. So we typically have maybe a few students that actually choose to do the dual degree options. We also offer 2 different curriculum tracks for students to choose from, because we know that students, study differently, and not everyone would pretty much be in the same cohort or study the same. So we do offer a problem-based learning, which is a little bit more of an independent style of learning. The basis of learning for that are these clinical cases that are presented each week, and you work in small groups of about 8 students to pretty much come up with a diagnosis by the end of the week. It is led by a faculty member. We offer another curriculum track called the Synergistic Guided Learning, pretty much a big name for your lecture-based curriculum, which does incorporate small group sessions as well. Both tracks do merge into your clerkship years, and alongside there are these longitudinal courses that all students will partake in. We also have a really great simulation center that was redone about a year ago, and there's some really great technology in there. And I always give this story about our sim team or sim club, that back in 2019 at the annual AMSA convention, there's this simulation challenge that takes place every year at that conference. And our students actually beat out all DO, MD students from other schools to win the national championship. So I kind of brag about that, because this was before the expansion of our simulation center. And we also now have a second campus, which is opening this July for problem-based learning. Specifically, it's in Sewell, New Jersey, which is about 20 minutes from our current campus. This will bring our total enrollment to about 288 students each year, making us the largest medical school in New Jersey. And prior to this, we are the only medical school that graduate more physicians in the workforce for New Jersey. So again, skipping over quite a bit, what are some of the things that the admissions committee looks for? So of course, GPA is important. Your science GPA is extremely important. Our committee recommends about a 3.4 and above to be considered competitive. For students who might have a lower science GPA, they may want to consider a really rigorous post-baccalaureate program or a graduate degree. For the Mcat, we recommend about a 500 and above. Our committee does like to see, in particular, a 126 in that bio section. Years of data have pretty much shown them that a student coming in with about a 126 bio, they're able to be successful in the curriculum. So of course, outside of the MCAT, the GPA grades, holistic review definitely kicks in at that point where we do want to look at everything else. So all of your accomplishments, your community service, your commitment to the community leadership, clinical, pretty much everything that really makes you uniquely you. For letters recommendation, we do not require a letter from an osteopathic physician. However, it is recommended, but we do require at least 2 science letters or a committee letter. We also offer an early decision program for students who might consider Rowan S1 their top choice. For that, students need to have a 3.60 cumulative GPA or a 503 minimum MCAT score. If any student is interested in shadowing any of the curriculum tracks, whether it's PBL or SGL, we do offer that. I'm not sure if we still have a virtual component. I can definitely find out, but we welcome the opportunity for students to be able to sit in on classes and really get a good understanding of PBL or SGL, which track they more align with. I will also put this link in the chat for anyone who may want to schedule a one-on-one admissions consultation with me. This is a great opportunity for students to upload their unofficial transcripts, resume, MCAT scores, and really bring all of their questions and concerns. And we provide really informative and pretty transparent feedback on what a student might need to do to be considered competitive. So thank you very much. Again, I know I sped through quite a bit of information. At this point, I am gonna open it up to any questions that students may have.
Nigel, you mentioned earlier that that one of the important criteria that you use to look at candidates is their GPA. So let's say a student had, had a rougher beginning and has since kind of been able to display a better GPA and a progressively so through the last, let's say, 2 years of their education. Is there anything else they can do, but still it may not be as competitive a GPA as other students might have? Is there anything else you would suggest they do in order to make themselves more competitive? Like, is it, if they did more clinical experiences that might then kind of balance out, or if they did more research that might balance out that GPA, or if they did significantly better on their MCAT score, then that might also significantly.
Sure. So in full transparency, if a student does have a lower GPA, we strongly recommend a graduate degree, even if your MCAT is really high, just due to the competitive nature of getting into med school. A student with a 3.0 science GPA, for instance, and a 25 MCAT, unfortunately, that may not even do it because the committee really is looking for well-rounded applicants, and they want to ensure that a student is able to handle the curriculum. So all of the indicators they're looking for, that 3.4 at least, and a 500 MCAT, those are all a set of parameters that they're hoping students will have to be able to handle the curriculum. So that is usually a common question we get from students, whether, you know, something will offset that lower, I guess, performance, whether it's in the MCAT and a high GPA or vice versa. But yes, we strongly recommend a graduate degree at that point.
So a two-year master's degree where you can prove yourself capable of handling more competitive science courses would be something that would be considered something that could, again, offset your lower GPA as an undergrad.
Right, exactly, because usually, you know, those grad programs tend to mimic year one of med school, so it really is a good indicator.
Thank you so much, Mr. James. Sorry, we just need to make sure.
Thank you so much for having us.
If you could put your email in the chat so then other students could email you with private questions. Okay, so I'd like to introduce the Philadelphia College of Osteopathic Medicine, Mr. Cox. Are you ready to present?
Yes, I am. Can you hear me?
Yes, we hear you.
Awesome. Thank you so much for having me this evening. My name is Jonathan Cox. I'm the Associate Director of Admissions here at the Philadelphia College of Osteopathic Medicine here at our Philadelphia location. Bear with me for 1 second and I'll share my screen here. All right, can everyone see that presentation?
Yep.
Awesome. All right, so again, thank you so much for having us. PCOM, we are the third oldest college of osteopathic medicine in the country. We were founded back in 1899 by O.J. Slater and Mason W. Presley. So we have a long-standing history of osteopathic medical education and research. We currently have 3 locations. We have our main location here in Philadelphia, Pennsylvania, which is located right off of City Avenue, our Route 1, which is on the western part of the city of Philadelphia, right on the border between Philadelphia County and Montgomery County. And now we have 2 additional locations within our state of Georgia. We have our Sewanee, Georgia location. Sewanee opened up back in 2005. And Sewanee is about 40 minutes outside of Atlanta, as a suburb of Atlanta, Georgia. And our newest location, our PCOM South Georgia location, located in Moultrie. Moultrie is about an hour north of Tallahassee, Florida, in a rural section of the state of Georgia. This is our total enrollment there at the bottom, and that encompasses not just our osteopathic program, but a whole host of other graduate and professional degrees in our physician assistant studies, biomedical science, forensic medicine. We have a whole school here at Philadelphia for a school of professional applied psychology, for clinical psychology, mental health counseling, school psychology, educational psychology, our new program in applied positive psychology, and leadership programs. Also at our Sewanee location, we have a Doctor of Physical Therapy and our Doctor of Pharmacy degree as well. And our newest program, our Masters of Laboratory Science. So a whole host of not just our osteopathic program, but a lot of other graduate and professional degrees as well. I wanted just to talk about just a little bit about our curriculum for the osteopathic program. We do emphasize doctors from day one, and what we do is we integrate everything together. So we don't have, like, you won't be able to choose a track or a modality of teaching, but what we do is we take basic science lectures along with hands-on labs, and then integrate all that together in what we call CRIBS, which is clinical reasoning and basic sciences, in which you take everything that you've learned in the core basic science lectures in your lab work, whether it be the anatomy lab, primary care skills lab, and OMM lab, and then you apply all that to case studies, in which you then work through it, which is problem-based learning. So you get a foundation, you learn hands-on skills, and then you start to apply and think like a physician all throughout the first 2 years. We have a strong emphasis on interprofessional education. As I mentioned earlier, we have a whole host of other graduate and professional degrees, and all those degrees help patients in a variety of different ways. So how do each different degree program, how do they all interact and help the patient in their own respective fields, so they all collaborate together to give the best patient experience. A great example of this is with our fourth-year medical students and our clinical PsyD students. They may go into a shared exam experience within our family medicine practice, in which a fourth-year medical student may go in to do a full history and physical, and our PsyD student will also be doing a mental health assessment. So they both collaborate together to help diagnose and then help to put together a treatment plan for that patient and collaborate together. We have a strong emphasis on cultural competency. We want to get our students well prepared for an ever-changing and diverse world and make sure that they will be successful in that world, and also with professionalism as well. That was in our first years. Our third and fourth year curriculums are obviously your rotation years. We have during third years a lot of your general rotations, and then fourth year you get a little bit more electives. Our rotations are predominantly throughout the greater Philadelphia metropolitan area, so the city of Philadelphia, its surrounding suburbs, southern New Jersey, Delaware. We do have a lot of rotations all throughout the state of Pennsylvania as well. Up in the northeastern part of the state, if you ever heard of Geisinger, which is in Danville, Pennsylvania, we have a lot up there, the Lehigh Valley as well. We have a lot of rotations there. And we also have a lot in the western part of the state in the Pittsburgh region as well. Talk a little bit about our residency match. Our students do very, very well in terms of the match process, and especially even after the National Resident Matching Program, everything kind of combined together between the MD and DO programs, and our students still do very, very well in their residency match. What you see here tonight is just kind of a highlight of where some of our students have gone, not only in terms of specialty, but in terms of location as well. Our students go into all specialties, although we do have a lot that go into primary care roles, which we would consider family medicine, internal medicine, pediatrics, geriatrics, OBGYN. They go into every other specialty that's out there: surgery, emergency medicine, rehabilitative medicine. We've had a large boom in psychiatry, students matching into them. We've also, each year, we'll have students who match into ophthalmology and dermatology. Both are very competitive residencies, and we do have students each year that do match into those specialties. So essentially, whatever your interests are, the door is wide open for you. If you wanted to know more about our residency match, do visit our website at pcom.edu and click on, you can either type in the search chat or the search bar, or you could go to our student affairs page, and there will be a link for match list, which it historically goes back at least 3 or 4 years. And you can see over time where our students have matched in terms of specialty and location. Talk a little bit about, we do have some dual degree options with our osteopathic program. We do have a DO MBA. It's in healthcare administration, and that's in conjunction with St. Joseph's University. And St. Joseph's right down the street from us. We have 2 different options with a DO MPH, one with Temple and the other with Thomas Jefferson University, both in Philadelphia. Then we have 2 additional options with our DOS MS in leadership and forensic medicine. The DO MS in forensics is a great option if you are interested in becoming a pathologist. So they're just some of the highlights of the program. And just this is our process, and down to one slide. We do a holistic review of the application. It is both quantitative measures and qualitative factors. So yes, we look at grades, how well you've done in the science courses. We look at trending grades. So if we see an upward trend, if freshman year doesn't go that well, will we see improvement? That's taken into consideration. Mcat scores, also important as well, but then the non-metrics as well. So statement, your letters of recommendation, the interview before to get that far, all that is equally important to us as your metrics and as your numbers. So we take all that into consideration when we're making our decision whether or not to accept someone into the program. I know students like to see numbers, so this is for our Philadelphia campus in terms of metrics. Medians, just so you're aware, so medians 50th percentile, that means half the entering class of 2021 was above it and the other half was below it. And for the Philadelphia campus, we look for an entering class of 270 students. Our Georgia location, 135 and 59 for our South Georgia location at this time. So feel free, I would encourage you, please visit our website at pcom.edu. We have a lot of events. We do a lot of virtual events right now. We hope to be able to bring students back onto campus and get you to see our wonderful campus in the coming months. So stay tuned and feel free. I'll take a moment here. This is our QR code. If you want to take a picture of it, I'll leave it up for a second. You can get on our mailing list. We do blast out different events that come up and also, different things that are happening on campus. So feel free. I'll wait a second here if you'd like to take a picture of that QR code and fill out our electronic form there to get on our list.
All right.
Then finally, and that's our contact information if you have any questions.
Yeah, if you could just drop your email.
Thank you so much, Mr. Cox. Yeah, please drop your email in the chat and hopefully students will be able to forward their questions to you. Aaron?
Absolutely.
So, all right, we want to move on with the University of Buffalo School of Dental Medicine. We have Brooke Thornhill with us if you're ready to get right into it.
Yep. Okay. Hi, guys. I'm Brooke. I'm actually a third year in the dental school here, but I'm the UB representative for admissions. So seriously, at any point, if you have any questions, please let me know. I'm just going to flip through this because it's too full. But again, please feel free to let me know if you guys have any questions. We're all the way up here, not too far. But something for us is, again, like I'm sure as you've heard from all these other schools, no matter what concentration, like every school really is different. So make sure you get to know some of the schools you want to know before you get there. So then when you're applying, you at least have those prerequisites in mind. And something really big about UB is we really stress that we are a holistic application. We will not just look at your grades. We will not just look at your DAT scores. We really do take into account volunteering, community service, and anything like that. For us, you need a minimum of a 3.0 or better, and then a minimum DAT of 15, but 16 in comprehension. And those scores do last for 3 years, where your other credit hours last for, your in-school credit hours last for 5 years. And something that I'm sure has been stressed, but we really do want to make sure that you have at least some shadowing in, because it's very important that when you come here, you kind of at least have some clue that this is what you want to be doing. And that's why it is very highly stressed, and why we say quality over the quantity, because again, like you want to make sure what you're doing is, you want to know that you're coming here for a good reason. And for community service, whether it's what we do versus what you guys are working to get here, it is highly valued. But if you feel like you're lacking in one area over another, say like leadership, really do not stress, because we really do stress a holistic application. And we're gonna skip these just because I know you guys probably heard enough, but like, so this is our new pre-clinic where it's brand new. We have about 10 pods in each area. We got a couple $1 million grant a couple years ago, so it has been really great. And then we, in the clinic, we do not make our own appointments. So we have doctors, welcome staff center that make that for us. And everything really is provided right there for us. And I will say that like when we get to clinic, you feel very prepared. They really do set you up in a good way. And these are just rankings that they always like to show. And really at our school too, we really do stress research, because you do not have to do it. It's something that I personally don't do, but a lot of people in the school do it because it really betters them. And even forgetting when you're here, when you're in undergrad, it always does help. But again, it's not something that's make all be all in every application. Something else big in our schools, we really do have a very big, anytime, if there's a club that's not here that you want, you can easily make it happen. But these are just a handful of the multiple clubs that are on campus. And also there are many, many, many student life events. So again, feel free to ask me any questions, knowing more from like the student level. And yeah, like I said, really with community outreach, once you get here too, we do a lot of, free care to children, free care to veterans, and taking this mobile dental unit out into underserved areas. And then lastly, with BOCA, it really is, it's a student-led organization going out into different areas, not just in the community, statewide and also globally. They just came back from Dominican Republic the other day. So like here, like they just went out, spring break. We're going to Sierra Leone over the summer, and like they go with faculty, and it really is such a great experience. And it's something that if you want to go on, you'll be able to. And I know I flew through that, but I figured I'd go through more if you guys have any questions. You can contact this email if you want to be added to our listserv. We have constant webinars every single month, a lot of Q&A sessions, and we also have a mentor-mentee program that you're more than welcome to just email this and we'll send you the link right away. But yeah.
Yeah, so I have a quick question. You spoke about how you guys are big on research. I don't know if you'd be able to answer this, but when you guys look at like a potential applicant, is research necessary? Is that like something you want?
It's not necessary, but I will always say it looks good, but it's not like a make all be all that if you don't have it and you feel like, oh, I really don't want to be doing this, or oh, like whatever other circumstance, you don't have to do it. I can't say it hurts, but it also isn't, everything on an application at all. My email in the chat too, if anyone has.
So if anyone has any other questions.
Perfect.
Brooke, can I ask you to, if you could share with us what you think a profile of a competitive candidate would be?
I feel like I said, we really stress holistic. So instead of really putting all your eggs in one basket, like they really do like to see that you are a very well-rounded person instead of just, grades and that's it. They like to see that, you have a life outside of dental school and you can bring that here to dental school. So whatever that means, there's nothing specific I'd say makes a good applicant over a bad applicant, but I'd say that if you feel like you have a decent amount, you're well-rounded, not just everything in one, I believe that always looks great.
Brooke, I also know that during COVID, I think some dental schools were a little bit more lenient about not having, let's say, shadowing or work experience with dentists. I assume that has now passed. Is that correct?
Yes. A lot of it has where they're still lenient with applications, understanding that a lot of dentists still are not comfortable with, going into the office. So they do understand that. And if you talk to them and explain that, they're very lenient with it. But a lot of it has passed where everything with us is like, we are completely back in person, have been for a while. Especially our school too is doing in-person interviews. Like we really are trying to go back to normal as soon as possible.
And other than just shadowing dentists, is there any other clinical experience that you think will, again, Buffalo School of Dentistry looks for? Like, is there any other kind of clinical experience other than shadowing dentists?
Mm-hmm. You can also assist. So that always looks good too, because that's when you are actually getting paid. So it's up to you if you want to pursue something like that before. And there also are some enrichment programs, some academic enrichment programs. I know Rutgers done one, Stony Brook does one. I think it's called Discover Dental School. Those again are not required, but it's just something that shows when you get here, this is what you want to do.
In your opinion, you may have answered this. I didn't hear all the questions. My internet is very unstable. In your opinion, what do dental schools prefer? Is it if you were to shadow, let's say, for a very long time, but you shadow one dentist, as opposed to shadowing dentists of different specialties, whether it be orthodontistry, oral surgery, endodontist, and so forth. Do they value more that you get a broad view of all the different specialties, or just shadowing a general dentist, suffices?
Yeah, like there's no direct one answer that I feel like one is better over another. I will say I do think they appreciate when you do see at least two people instead of just one. Like I know, like for me, like my mom's a dentist, so I was like, let me make sure she's not the only person I'm shadowing because that might look a little skewed. So personally, I feel like it doesn't make or break if you're going to get an interview, but it was something for me. Like I shadowed at a decent amount of specialties before, and it came up in every single interview I did because it was kind of one of those talking points that they liked, and maybe it did help me get here a little bit more.
Okay.
Again, it's not something you have to do, but it always does help.
Good.
All right, if there aren't any other questions.
Yeah. So that was the last presentation.
Yeah.
Thank you everyone for participating. And
Thank you, Brooke. Thank you, Brooke.
Thank you so much for coming out tonight.
Thank you.
Thank you to all of you that
Thank you guys
organized
for
it.
making it.
Thank you to all of you that organized it, and thank you to Ms. Naomi Cap for all of her hard work as well.
Yes,
Thank
and
you.
I think is Dr. is I'm sorry. Is Lolita Woodhill still on? Lolita?
I don't think,
because I think she might have wanted to talk about some of the CATS programs, but yeah, I just want to then reiterate Dr. Lowy's thanks to everybody here, especially all the student leaders who did a yeoman's job, people's job. So really, thank you so much for all of your assistance and your help and getting it out. And I really think it was very, it was critical for the success of the program. So thank you all. Amelia, Lazar, Aaron, I don't want to leave anybody out, which I know I've already done. So all of you, thank you.
Thank you, Ms. Cap. Thank you, Dr. Lowy, as well.
Ms. Cap did most of it. The other thing